ऑप्शन देना ना जब मेरा टर्न
हर एक को कोहोस्ट बना दो, हर फैकल्टी को
है। आई थिंक ऑप्शन है। ठीक है,
मैं 4 बजे आता हूँ फिर।
श्रीकांत, ऑल द बेस्ट, बाय।
थैंक यू सो मच सर, थैंक यू मैम, थैंक यू।
Question 3 hours, right? Mainly clinical. Proportion of image.
PSM was particularly difficult.
All the best. Bye.
Thank you so much, sir. Thank you.
It's already live.
Thank you.
It's live on YouTube. Yeah, it is live.
Yeah.
Shubham, it's live, so we can start talking.
Yes, sir. We are live now.
All right.
200 question 3 hours, right?
Right. So
Mainly clinical.
thank you very much.
Proportion of image.
This is Dr. Apoor Mehra, and I am very, very happy that you could hear behind the scene and the role Zana plays in the sessions. So she keeps on guiding us at the backside also. And we are happy that we are able to collect some of the questions. We only wish that whatever we are able to recollect, you get them correct. I represent Cerebellum Academy here. My name is Dr. Apoor and I'm an orthopedic surgeon. All right. And I just love to connect with the students. And post-exam is the best time because the stress is a little less. Exam ho gaya. 2 ghante ho gaye. This is the time when you can really think about what you want to do this evening. And we'll make sure that we take away the difficult part, right? The recall of the questions, so that after that, you can go and enjoy your golgappas or chola bhatura, whatever, and then get ready for the next leg. I wish that all those who have attempted the paper, all of you are rank 1. And then you can have a recording with Zainab, rank 1 versus rank 1. And now talking about orthopedics, we were just talking about few of the things that came there, right? So I'll just demonstrate to you how you look at the patency of the artery, or the patency of the radial and the ulnar artery. So when you look at the hand here, right? If you look at the hand here, this hand has got 2 major arterial supplies. One is the radial artery, one is the ulnar artery. And this is a pink hand of an orthopedic surgeon. All right. So when I press both the radial and ulnar artery here, all right, and I keep on squeezing my hand. Once I keep on squeezing my hand with the compression, this hand will become relatively white. All right. So this will become relatively white because of the compression of the arteries here. So when I have compressed, so it will look white. And now when I release my radial artery here, this will become more pink. All right. So it means the radial artery is intact here. All right. Now I will repeat it again. And I will repeat this test. And then if I will see it, it becomes whitish. And if I remove the ulnar artery, it becomes reddish. It means my ulnar artery is working well. So this is the Allen's test, which is being followed, right? The second thing that came in the exam was an image of a shoulder joint, where they had asked you, this is a traumatic shoulder, what is the damage that can occur? So around the shoulder, it's usually the acromioclavicular joint which is disrupted. And they had given you the options of different ligaments combination, which I'm sure during the day we'll get the options and discuss in detail in the Cerebellum app for you. The third question was a bony growth, all right, going away from the joint, or a representation of an osteochondroma. And they had asked you about the malignant transformation of osteochondroma. All right, so osteochondroma, right? So the most common malignancy that comes into osteochondroma is a chondrosarcoma. All right, and chondrosarcoma is a cartilaginous tumor. So to look at it, you look at an MRI with a cartilage thickness more than 2 centimeters. That's one of the parameters which is very, very useful for you to assess. All right, and then the other thing that is there is the loss of continuity with the parent bone. So it was given that the bone, it is continuous with the bone. The marrow is continuous, so it's not malignant transformation. And the third option was it goes towards the joint. Again, that was not an option. The other two questions were an overlap with Dr. Zainab. One was about talking about the McAcune-Albright syndrome, the 3 Ps, the precocious puberty, the pigmentations, the cafe or spots, and the polyostotic fibrous dysplasia. So they had spoken about this as a McAcune-Albright syndrome, which they had spoken. And Zainab, one more question was there. We were talking about it. We have spoken about the shoulder, the Allen test. We have spoken about the osteochondroma. We have spoken about the McAcune-Albright syndrome.
That's it, sir. I think rib fracture tha.
Pelvic
One
fracture.
over-
Pelvic fracture, right? So pelvic fracture is an area where anybody who can tell me that what bleeds in a pelvic fracture. So in a pelvic fracture, it is the cancellous bone surface that bleeds, and it is one of the injuries which has got very high mortality. So the main aim is to do a proper resuscitation and try to prevent life by decreasing the blood loss. So you have to compress the cancellous bones together so the blood oozing stops. And one of the ways of doing it is an external fixator. But if you have nothing, then you tie a bed sheet around the pelvis and try it down. That was done in the older time before the fixators were discovered. It was called as a hammock sling, which we'll talk about as I discuss about these questions. All right. So now I will pass on the baton to the much awaited person in the group, Dr. Zainab ma'am. Take away the session, because students they are thrilled to see you, and I think so they want to listen to you. And followed by you is the best voice of Cerebellum, Dr. Sparsh Gupta, waiting in line. All right, thank you. Bye bye.
Thank you, sir. Hi, guys. I hope the paper went well. So the early feedback that we're getting is it was slightly on the tougher side. There were a few atypical questions, but that's how usually AIMS is. You will get at least 20 questions which are like borderline crazy. So that is how usually AIMS will ask. And the subjects also, which we are getting the feedback is ophthalm and PSM were probably on the tougher side. Is what I could hear. So how was it? Would love to hear from all of you how the exam went. And we're doing this, I think, probably the earliest just to, connect with you. The main aim of this session is not to get the exact questions and not to really stress you with the exact answers and, you count your score. The main aim is to just unwind, and now you're done with the exam. So just let's just talk and relax now. This is not to now burden you ki acha kitna score hai, kitna rank aega. Don't go into that spiral. Just chill, and even if you're watching this session, just watch it for a learning ki what could have been better, and where was my thinking probably going in the exam hall, because you're just fresh out of it. So as far as radio is concerned, I'll just share my screen. I got a few questions, out of which few definitely were overlap with ortho. Is my screen visible? Thank you. Thank you for all of your kind words. Ever since the exam's over, we're just trying to speak to all of you guys, trying to know how it was. And I always feel like it's my own exam, anytime any exam is happening. I'm just trying to share my screen. I'm going to try again. Yeah. Thank you. Okay, I think it's visible now.
Yeah, it is visible, Zainab.
Yeah, all right. So I think we had around 5-6 questions, which are again overlapping with other subjects as well, but let's discuss what we can. So there was a chest X-ray which was given. Was it similar to this? So chest X-ray was given with rib fractures, and they had asked you about what are the ribs. So basically this involves counting ribs, and what I noticed was a very similar question came in 2023 FMG also, so a lot of overlap of topics that's happening pan exams also. Like earlier we had seen that FMG questions are coming in NEET, but now overlap is there with INICET as well. So if it was a similar question, I'll just tell you how you go about counting the ribs very quickly. So this is the first one. First पहचान लिया ना तो नीचे का becomes very easy. So this is how you have to identify the topmost head. It comes much more anterior. So this is the first rib. First and second में ही usually doubt होता है. Alright. So this is the second one. So this is how you go from posterior to anterior. This is the process that you have to take, and हमेशा ऊपर से start करना. You never jump directly कि this would be the fifth rib. Alright. So AP view तो अच्छा, AP versus PA तो I don't know how you have said that. Was it written that it was an AP view? लिखा होगा ना, वरना तो पहचानना बहुत मुश्किल है without that. And in trauma, usually it will be AP view because patients can't stand and get a PA view. So अगर rib fracture है तो वो AP view ही होगा usually, you know. So that doesn't make a difference in counting ribs. AP view है तो भी rib counting same ही रहता है basically. So this is the first rib. This is the second. I'll just tell you. Obviously, I don't think this was the exact image from what I am reading. ये image नहीं था. So we'll try and find the image, but otherwise also just know how to count the ribs. That would be the learning point. So this is the first one, this is the second, this is the third. तो इस image में आप देख सकते हो यहाँ पे fourth onwards there are fractures. So fourth, fifth, sixth and seventh are fractured in this case. Okay. तो ये है. This is how you go about it. Exact image, I don't think, we have yet. It's very early. So we will try and find the image which was there. A very bad X-ray. Most of you are saying the image quality was not good. Okay, then it becomes kind of a difficult question. And I think the options were also very close. 5, 6, 7, 4, 5, ऐसे करके भी image, options थे. So I guess a tough question then. In case the image quality was not good, then counting rib fractures is a tough job. All right, so this was one question. फिर McCune Albright was typical, precocious puberty with fibrous dysplasia. If you're given, it becomes very typical. Plus you have cafe-au-lait macules. I think that was also given in the image, है ना? Skin lesions थे and fibrous dysplasia था, precocious puberty. So this is straightforward. इसके अलावा you can also remember Mazabrod syndrome is there where you have myxomas with fibrous dysplasia, for future purposes. So this is about FD, polyostotic fibrous dysplasia. उसके बाद osteochondroma, Apur sir also discussed this. So what are the features suggesting malignancy? So we look at MRI, right? MRI is the investigation of choice for osteochondroma. We look at the cartilage cap. So one of the options was that a feature of malignancy is that marrow, the bone marrow continues with the lesion, that always is there. So the criteria for it to be osteochondroma is that the bone marrow and cortex is continuous. So that's not a feature of malignancy. Even pain is not a feature of malignancy. A feature of malignancy is monitoring this cartilage cap. Okay, so you measure the thickness of this cartilage cap, or agar wo 2 centimeters, some people say 1.5 centimeters. So I think 2 was given in your question. Then we say that it is fibrous dysplasia. Okay. How many from BTR to abhi pata nahi hai, we'll know, right? You guys will only tell me what is the exact number. Abhi to 200 questions only we don't have, but yeah, if you want a strike rate, let's see, we will know. But overall, more important than the number is that were you confident? Did it provide you with the last moment revision that made you confident? That's the more important part than the number of questions, I feel, So this is osteochondroma malignant. Then there was an ultrasound image with a Phrygian cap. I think this was a pretty similar image to what was asked from what I have gotten the feedback. So this was a cap. It is just an anatomical variation. Remember, for future purposes, isse malignancy risk nahi badhta, isse kuch nahi hota. It's just an anatomical variant, which is a Phrygian cap. Sometimes it can mimic a malignancy, when it gets thickened, but apart from that, it's completely benign. It's just a variation. Okay, so nothing to do, just an image was asked to you. Then you had MRCP image with a signal void like this. So this is a stone. We've seen this so many times in our classes, So this is, and I don't think they would ask anything else in an MRCP at your level, So the other options were like a pancreatic duct stricture. So they will never ask you these tough diagnoses, right? So even if you can't figure out, always go for the more common things. They are more commonly going to be asked. So in an MRCP, more likely than not, it's always going to be a choledocholithiasis. Okay. McCune Albright wala LCH nahi ho sakta. So it depends on क्या डिस्क्राइब था? सो प्रोबेबली यू वर गिवन स्किन लीजन एंड बोन लीजन, तो उससे हो सकता है, बट देन वाज द बोनी लीजन लाइटिक, इट वाज इट अ चाइल्ड? उसके अलावा प्रिकॉशियस प्यूबर्टी अगर मेंशन था तो फिर एलसीएच नहीं हो सकता. अगर प्रिकॉशियस प्यूबर्टी है देन इट गोज मोर इन फेवर ऑफ मैक्यूनाल ब्राइट ओनली, राइट? ये क्वेश्चन थोड़ा ट्रिकी. I mean, I don't think this is exactly correct. One of these options need editing because all are true in this case. So just review this and tell me like what is different. So which of the following is not an advantage of ultrasound over mammography? So first is ultrasound can be used to detect mammography undetectable tumors which are palpable. So this is definitely true. We use this in practice. जब patient कह रहा है palpable lesion है, mammo comes out normal, we will do an ultrasound correlation. So this is true. This is definitely true that ultrasound is the best to distinguish solid and cystic. तो इसमें तो कोई doubt नहीं है. It can be used for guiding biopsies. Definitely true. तो इन दोनों में तो कोई doubt ही नहीं है. And in young females with dense breast also we use ultrasound. We don't use mammography, and that is the main point of using ultrasound in young females. So all are true in this case. So there is some difference in the recall here. Agar same exact option tha, then I would have, if I was in your place, I would mark 1 because it is the least correct. It's not a very well framed question. INICET does do this at times, where all options will seem correct and you have to then choose the least correct one. So in that case it would be 1 because the others are definitely true. So yeah, you guys are saying it was the same options. Apart from this, I think I heard that there were 3-4 answers which are marked only in the exam, that they'd given in the bracket that this is the correct option, which is very funny, and it is good for you. Don't complain for this. I mean, इससे better तो कुछ नहीं हो सकते if they give bracket में correct. And the worst part would be if इसमें भी आपने overthink करके बोला कि ये तो नहीं हो सकता, they must be tricking me, and then you mark something else. Then nothing can save you. So basically, just whenever such things happen, and it can happen as long as we are living here in our country, it will happen. So in such cases, just take the win and mark what has been marked as the correct answer. Overthink नहीं करना ऐसे में. And I think few were repeated also. Same question 2 बार आए थे probably. So yeah, I guess that's fine. It will only, I don't think they will be excluded from your total. So I hope you've marked those correct. Yeah, anything else that you want to ask? So this is all I had for radio so far. Anything else, we will talk, and we will come up with a proper recall. As I said, this session is basically meant to just talk and that how it went. So I don't think it's right for me to take more time. I think everybody is waiting to hear from Sparsh sir, and sir has path questions ready for you. Sir, please.
Dr. Sparsh sir, good afternoon.
Hi sir, good afternoon. Good afternoon everybody. I hope all of you are doing really well. And even though Madam expressed certain reservations to predicting the number of questions which came from her BTR session, but Madam, I can assure you the numbers were almost touching anywhere in the range of 100 to just about 100 plus.
Thank you, sir.
Sparsh, ये इतनी सारी किताबें पीछे रखी हैं, तुम रोज पढ़ते हो ये?
सर ये दिखाने के लिए होती हैं कुछ.
Okay.
It's just to create an impression that you are dealing with somebody who happens to be having some kind of an academic background and stuff.
This is what Zainab just said. Even in the question, they had marked the 2 answers, Question दिखाने के लिए था, आंसर भी था उसके अंदर.
Exactly. तो ऐसे 3 क्वेश्चन थे सर जिसमें वो आंसर्स थे और उन्होंने वो स्टार मार्क कर दिया, नहीं तो वो इनफाक्ट वाला एरिया पूछ लिया तो पीका वहां पे मार्क किया हुआ है और एक में तो आंसर ही बोल्ड करके हाईलाइट किया हुआ है. तो आई थिंक considering this as a human error, let us just forgive the people who are involved in the conduct of the exam. Let us not make too much of a hue and cry about it. But I think all of you with respect to the pathology questions would have been really happy because it is after a long time that in an INICET kind of an exam, you got almost like 7 to 8 questions from GPath. I mean, I personally have never found beyond the FMG exam somebody asking you about the type of hypoxia you would associate with a particular condition. That's a usual thing I start off the discussion with. And to get a question each on necrosis and then apoptosis and then immunological tolerance and stuff, that was really good. Well, not wasting too much of your time, let us just talk about the questions. So the very first question, I'll just talk about the questions, and obviously as Madam also said that we will be coming up with a proper recall for you. Hence, just bear with me with regards to the limited options that we had, right? So we got a question in the exam which was pertaining to the type of hypoxia you associate in a patient who has suffered from carbon monoxide poisoning. So as we understand well that it is going to be anemic hypoxia, which most of you got right? The second question is when we talk about the regulatory genes involved in the process of apoptosis. So they asked you about the name of the anti-apoptotic gene. Most of you are familiar with the examples as well. So we got an example like Puma, we had BAC, we had BAD, and we had MCL1. In case somebody doesn't know what is a potential question for the exam, MCL1 gene is also involved in the development of resistance to the anti-cancer drugs because of its influence so far as the process of apoptosis is concerned. We then got a question in which multiple options were correct with regards to necrosis. Do correct me if I am able to recollect the options. So one of the statements which was made a mention of was that swelling is present. Another question which made a mention of was inflammation is present. A third statement was it is physiological in nature. So we understand really well that necrosis cannot be physiological. It is always pathological, right? So multiple types of options, like 1, 2, 3 are correct, 1 and 4 are correct, 2, 3, 4 are correct, something of that sort. Then we had a couple of questions pertaining to amyloidosis. So one question was straight away one-liner in which they asked you about the name of the subtype of amyloidotic protein which is seen in a patient who is undergoing dialysis. So that would be associated with CKD patients, and we really know well that it is going to be A beta 2 and not to be confused with A beta. That's the point that we discussed. Okay, membrane disruption is what Dr. Roja is giving us as a hint. Thank you, ma'am. Then we had a question on the statement-based question pertaining to amyloidosis, wherein they talked about the type of amyloidosis and secondary amyloidosis, and it had made a incorrect mention of AL. So we all know AL is primary amyloidosis. It also made a mention of the structure of amyloid, the beta plated structure on the tertiary examination or the X-ray crystallography, as it made a mention. Then it made a mention of amyloid word is related to. I mean, that's a first line that you read in Robbins, or for that matter, even Hirschman for that matter in our lecture as well, related to the starch component of it. And obviously, we know it is an example of an extracellular protein. So again, a kind of an which of the following is incorrect, and the stuff that we were aware of, right? Another question was a repeat question wherein they talked about the presence of smudge cells on the peripheral smear, and they asked you which is the next best investigation to confirm the diagnosis of the patient. So that made a mention of the bone marrow examination. It made a mention of the cytogenetics. It made a mention of flow cytometry. So we all know smudge cells suggestive of something like chronic lymphocytic leukemia. And of course, in order to confirm the diagnosis, you would go in for a CD molecular presence with the help of flow cytometry, wherein you detect the presence of CD5 and CD23. So that was another easy one. Those are the 7 questions. We then got a question exam pertaining to immunology. One question which was asked after a really long time when we talk about the concept of tolerance. So they do make a mention of, they talk about the gene involved in the process of tolerance. So that is a central tolerance at the level of thymus. So when the question is about thymus, obviously he's talking about the T cell, and the negative selection pertaining to T cell is facilitated by the presence of a gene which is given the name of AIRE gene, right? Okay. Dr. Sushma, you are making a mention of Barth syndrome. Can you, are you sure the word is Barth, or was it something else? I mean, can you just talk about the options as well? I will just note it down and we'll just get back to you. So thymus, the tolerance is because of the T cell, and that is because of the AIRE gene. We all know really well, because if there is a problem with the gene, it is going to result in APS, that is autoimmune polyendocrinopathy syndrome, about which we made a mention of. Another question which was earlier asked in the INICET exam about, I think 4 years back, was a CD40 ligand interaction question, which was given as a graph question earlier. This time around, they asked you a question pertaining to which of the following is going to be seen as a finding in a patient who is going to be having a deficiency of CD40. So the correct option was pertaining to the hyper IgM syndrome, and obviously hyper IgM syndrome would be associated with the fact the patients are having elevated concentrations of IgM, and because that there is no antibody maturation and there is no isotype switching, so these patients are going to be having reduced concentration of IgG, IgA, and IgE, right? That is another one. Now, one question I believe which was already given to you, which we talked about, was Kawasaki's, in which the management was asked. So that was intravenous immunoglobulin, in which they perhaps gave you that option. Another question talked about the kind of condition that you associate with thrombocytopenic purpura. So thrombotic thrombocytopenic purpura. And then they were making a mention of, they did ask you about the importance of going in for a plasmapheresis in such patients. So plasmapheresis are responsible for causing the removal of the long polymers of the VWF, if that was the option given in the exam. Another question, which is a hot favorite, was with respect to hematology, wherein they talked about the vacutainers and the sequence. So most of us really know well that it is going to be the first one, that's going to be the blue one, then the red one, then the lavender one, and the gray one. So the sequence of the vacutainers was the question, which was order of draw, basically. That was a question which was asked in the exam. Again, a relatively easy question, I would say. Another hemat question was pertaining to Okay, vancomycin, nomogram. I think Dr. Neeraj, Dr. Govind sir will take care of this question. Don't worry about that. Then we had a question pertaining to the shelf life and the storage time or the temperatures at which different components of blood are being stored. So perhaps they made a mention of something like platelets at room temperature and then 5 days, then cryoprecipitate and fresh frozen plasma, respectively being stored at -18 to -30 degrees Celsius and, more than 1 year. Okay. Okay. I'll just keep on noting down the options about the Barth syndrome that all of you are making a mention of here. Perhaps we can come up with a more complete question, I would say. So cardiolipin, lyso, lecithin, as I'm getting the options. Okay. Then packed cells with the SAGM. They are perhaps asked you about the shelf life. So that was about 5 to 6 weeks, right? That is what they asked you as a question. Subsequently, we got a question on, I think, some kind of a mediastinal tumor. If somebody can just correct me and let me know. Maybe they asked you about a thymoma, in which they made a mention of certain statement-based questions, that whether it is the commonest tumor, whether it is anatomically located in the posterior mediastinum or stuff. I would be more than happy to receive the, the options from you guys. We then had a question about the role of BRCA1 gene in the process of oncogenesis. So one option was that it belongs to the category of the tumor suppressor genes. Another option said about the function of the BRCA1 gene, which is involved in the repair of the DNA damage being done. So yes, it is going to be having a DNA. Okay. Iron deficiency anemia was also asked. Okay. And then whether it is associated with ovarian cancer. So of course, BRCA1 gene is going to be associated in females, more pertaining to females having development of breast cancer, and the association with something like increased risk of ovarian cancer as well. A question which was pertaining to the differentiation of the male gonad, that is the testicular tissue, from an undifferentiated gonad, was dependent upon the SRY. And when you're talking about this kind of a gene SRY, it is located on chromosome Y. Which arm of chromosome Y is it located? It is located on the short arm. Perhaps that was a question. Can somebody just recall that particular question from me? Because that's not something that we talk about very routinely, though even we have made a mention of that particular fact in the book. But SRY chromosome, and what was asked? Fanconi syndrome, was it asked as a question, Dr. Divya? Or is it Franconia syndrome? Okay, another question was on coagulopathy, right? It was not bleeding disorder, I presume. Which of the following is the commonest cause of coagulopathy, wherein the options made a mention of protein C, protein S. Perhaps they should have made a mention of something like Leaden's mutation as well. Okay. And then what, antithrombin? Was that a question? Okay, which breast conditions? Long arm or short arm? So it is short arm, obviously, Dr. Itachi, as I understand. Another question is what we have talked about in the discussion of thalassemia, wherein after the discussion of alpha thalassemia, we always make a mention of that thalassemia can be an important cause of development of hydrops fetalis. And I've always made a mention of that fact that whether it is going to be a non-immune hydrops fetalis or a immunohydrops fetalis. So thalassemia is non-immune hydrops fetalis. Another condition which can cause NIHF happens to be something like parvovirus infection. And you have got a question in the exam which was all except questions. So all of the following are associated with non-immune hydrops fetalis except. And I think one of the options which was very clearly mentioned was ABO incompatibility. So that was obviously going to be the answer. So RH incompatibility and ABO incompatibility would result in the transplacental spread of the antibodies and might as well result in development of hemolysis. RH, if that was given to you. Okay, Fanconi is associated with BRCA. Some staining question also you're making a mention of. Okay, yes, there was some kind of a staining question. Perhaps it talked about the pattern that you are going to be observing, whether it is a nucleolar pattern or a speckled pattern or a centromeric pattern. Okay, smoking is a risk factor for fibroadenoma. Okay. Okay, they asked you a question, smoking is a risk factor for fibroadenoma or is it a risk factor for breast cancer? Did they make a mention of something like Zaska's disease as well, the periductal mastitis kind of a stuff? Okay, Leaden 5 mutation was there, smoking as a risk factor. Or SLE plus amyloidosis, what is the question we are talking about, Dr. Skill Media? Okay, MCTD, yeah, that was perhaps one of the last questions I was making a mention of. So MCTD question was some kind of history was given in the exam, which was associated with the presence of elevated levels of creatine kinase. And then the question made a mention of perifascicular atrophy, and the patient was also having the presence of a history of muscle involvement, muscle weakness. They perhaps asked you the name of the antibody. So anti-Jo1 antibody, which is going to be a feature of dermatomyositis. And if you're thinking in terms of scleroderma, then they gave you as an option anti-centromeric antibody. I'm sure in the ORR as well as in Zana ma'am's BTR also, you had a look at that wonderful table that she presented to you. Yeah, ductectasia was given, right? Okay, agreed. Okay, Mondas disease was also an option. Okay. No wonder these were not there. I mean, okay. So some people are saying that was as an option. Some people say it was not as an option. No worries. We will just sort it out. I mean, considering the number of people who said that it came as a question in the exam, then kindly just let me know about the speckled pattern, the homogeneous pattern and the stuff. I mean, I'm not able to recall the exact image because a lot of people, whatever we mark as an answer, we have a tendency to be biased. कि sir यही आया था, speckled ही आया था, और ऐसा तो हो नहीं सकता. Perhaps the last question was with respect to the association of red cell aplasia with a virus, which was having a slap cheek appearance. So most of us are familiar with it. That happens to be the parvovirus infection. So these were the recalls that I could had a collection of. I mean, about 15 or 16 questions. Most of them were easy, except for the ones in which certain one or two options were given deliberately as a tricky option. But needless to say that you guys have appeared in the exam now, and a good load off is your head. So just relax for the time being. Just try to find out the gray areas as we always talk about it. I mean, there is no point in having a comparison or a discussion with respect to what you have done or what you could have done. All of you did, you give your best shot. And I think this is a time when you can just focus on something which is better in your life. Rather, be happy about the 3 questions for which the exam, the answers were already declared. And to talk about more of that mental health issue, I think we have your all-time favorite with us, Dr. Praveen Tripathi, sir, who is going to be discussing now the recall questions of psychiatry with you. Thank you so much from my side. All the very best. God bless.
Thank you, Dr. Sparsh. Before Dr. Praveen starts, right, I will just like Dr. Praveen to speak to the students, like they have come out of the exam. There's a lot of anxiety. Now there's a discussion going on at Cerebellum YouTube channel, right? They will have a fair idea of what they done. What did they have done? But just tell them in your classical way that it is just an exam, because you are the person who's going to tell. ऐसे बहुत सारे exam आने वाले. Over to you, Universe Boss.
Thank you, sir. Am I audible and visible?
You are audible
right.
and visible.
Great. And my screen is visible too, sir?
Absolutely perfect.
Wonderful. All right. Hello, students. Good afternoon to everyone. And this is a bit contradictory. We are organizing this session right after the examination. And at the same time, we want to talk about how you should relax after the examination. So I just want to make one point here, that if you are one of those person who does not want to attend these sessions, who wants to take rest, that is perfectly fine. Please go ahead, switch off your phone or whatever iPad you're using. And if you want to relax, it's perfectly fine. We are doing this session because many students, start looking for the questions and the answers. So for that category of students, for that lot, we try to arrange these sessions. But if you are not one of them, you are not doing anything wrong. You can relax. And that goes without saying that it's one of the many examination, and no examination is life or death. So even if it did not go so well, that's perfectly fine. You have another exam coming up. All right, with that, I think let's start with the session. You are waiting for the session. All right. So I'm surprised to see as many as 8 questions coming from psychiatry this time. So the first question was a classical question. It has been asked multiple times in the past too. Very simple question. La-Belle indifference is seen in which condition? We know that lack of concern. La-Belle indifference is the lack of concern for the symptoms, and it is a feature of which disorder? Conversion disorder. So as far as the options are concerned, I think most of you must have gotten it correct. But if somebody could help me with this, with the options, I got to know about the conversion disorder. I got to know about the Cotard syndrome. I got to know about the schizophrenia. What was the 4th option, if anyone can tell me? Yeah. So can anyone tell me what was the 4th option here? Depression was also in the options, was it? All right. All right. So somebody told me that depression was also in the option. Another option was mania. Okay. Mania was in the option. So was Cotard syndrome not in the options? Conversion, mania, depression. And what was the 4th option? 4th option. Was Cotard syndrome in the options or not? Okay, everybody is saying mania, depression, mania, Cotard was not there in the option. Okay. So let's mark it. Let's mark mania here. But this was a very simple question. I think most of you must have gotten it correct. The answer is option A, conversion disorder. All right, guys. Okay, I understood that Cotard was not in the option. I have removed it. This was a slightly tougher question. And this question used to be, asked in the past by NIMHANS and even the JIPMER, but I was surprised to see it in the INICET examination. So SCOF criteria is basically a screening tool for eating disorder. All of us are aware of CAGE questionnaires, right? The ones we use for screening for alcohol use disorder. So SCOF criteria, which basically asks 5 questions. S stands for, do you make yourself sick because you feel uncomfortably full? Do you worry a lot that you have lost control over how much you eat? Have you lost more than 1 stone in a 3-month period? Do you believe yourself to be fat when others say you are too thin? And would you say the food dominates your life? These 5 questions constitute the SCOF criteria, and the SCOF criteria is used for eating disorders. It's not for alcohol. It's for eating disorders. Slightly tougher question. Even if you did not get it correct, it's perfectly fine. Ye mushkil question. That was a difficult question. Right? Can you guys help me with the options here? Eating disorder was there, I'm quite sure, and something about substance was also there. If you guys can help me with the options here, please. Have I written the right options here? Can you guys help me with the options? Sexual disorder, eating disorder, I've got it right. Sir, from where to study about the questionnaires? Mrinal, I would suggest do not study about these questionnaires. Only 2-3 CAGE questionnaire you should be aware of. SCOF now you have to be aware of. Otherwise, there are thousands of questionnaires. How many can you remember? Please remember, some questions are given in the exam deliberately. They are tough questions. You don't have to get all of them correct. It's impossible to get all of them correct. Stop losing your sleep over these questions. These are difficult questions. Acha, mental health dikha tha, okay. Eating disorder, sexual disorder, mental health disorder. Was it? And behavioral disorder. And was alcohol in the option? Behavior instead of... Was alcohol in the option? Eating... Okay. Was alcohol in the options, guys? Acha, behavioral disorder was there. Eating, sexual, alcohol, mental health. Chalo, theek hai. I'll figure it out. But basically the answer was eating disorder. You don't really have to care about the other 3 options. So the answer is option A, eating disorder. No alcohol. Okay. So instead of alcohol, there was behavioral disorders. Fair enough. All right. Let's go to the third question. Now, this was a very simple question. Which of the following is true about lithium? The first is it can cause fine postural tremors at therapeutic dosages. So yes, one of the commonest side effect of lithium is tremors. One of the commonest side effect is tremors. It is not absorbed from the GIT. Wrong. It is completely absorbed from the GI tract. Of course, we know about that. It is not teratogenic. Of course, we know it's teratogenic. It can cause Epstein's anomaly. All of us know about it. What was the 4th option, students? Can you help me with that? What was the 4th option? TTP नहीं था sir, ITP था. ITP TTP कहाँ से आ गया भाई? Psychiatry. Okay, I think you guys are having a parallel discussion at the same time. Lithium is also used for treatment of absence seizures. Okay. Okay, fair enough. Thanks a lot. But the best answer, of course, remains that it can cause fine postural tremors. And I know it's just a recall session, but if somebody asks you what is the drug of choice for that postural tremor, it would be propranolol. Chaliye, let's move to the next question. All right, this is again something that you must have gotten correct. It's a very classical question. Barbar exam mein aata hai, they ask it repeatedly. Patient who has schizophrenia being treated with clozapine. Patient has to undergo regular blood monitoring because of which rare side effect, right? This is a fairly straightforward question. The answer is A, granulocytosis. We know that we do the monitoring. We do the monitoring of ANC, absolute neutrophil count, and DLC once a week to start with. And why do we do so? Because we know that one of the rare side effects of clozapine is A, granulocytosis. I hope all of you got this one correct. It was a very simple question. Right? Yes. Yes, Minal, you're right. Yes, Asta, everybody is correct. I think this was a simple question. All right, another question. There is something about INICET examination and this delusion. They repeatedly ask it. A patient tells a psychiatrist, my brain is missing. What is the point of me eating anything? And later on, I got to know that this question was even more elaborate. It said that a patient with depression is not eating properly. A patient with depression is not eating properly. And then it says that the patient tells the psychiatrist, Dr. Devbrat, is this another question that you are mentioning here? Smell of alcohol, eye congested, motor, good walking, took alcohol under. Ye kya hai bhai? Melon-by effect. There was a question on Melon-by effect. Hypochondriac delusion was okay. This is nice. Hypochondriac delusion. Thanks a lot, Nishtha. Cotard won't be correct. A nihilistic delusion and Cotard delusion are the same thing, no? Options are wrong here. It had Cotard in the option. It had both things, nihilistic in the option as well as Cotard in the option. Patient was dead. Bizarre delusion was in the option. That's a bizarre thing. How can they put bizarre delusion in the option? So one is hypochondriac delusion, one is bizarre delusion. Assuming to be dead. Patient is assuming to be dead. ठीक है. Please tell me one thing. Was Cotard delusion and nihilistic delusion both in the options? That can't, I mean, if both were there, then that's a difficult thing. Are you guys sure that both were there? Some of you are saying that only one option was there, Cotard, and others are saying that both were in the options. Okay. And so had they asked the diagnosis or had they asked the type of delusion? Yes, both. So most of you are saying both were there. So let's presume both were there. And what was the exact question? Were they asking about the diagnosis or were they asking about which is the type of delusion here? Mostly music is 1000%. My brain is missing. Options, bizarre delusion, hypochondriac delusion, Cotard and illicit. What was the statement, guys? Okay, both were there. What was the statement? Huh. Type of delusion was asked. See, if they were asking about the diagnosis, since they have given the history of a patient with depression and then they are giving a nihilistic delusion, I would go more towards Cotard delusion. If they are just asking about the type of delusion, then I would go for the nihilistic delusion. Okay, let us not spend too much time on this question. If they're asking about the type of delusion, I would rather go with nihilistic delusion. If they're asking about the diagnosis, I would go with the Cotard syndrome. Let me talk about this question in more details and then I'll come back to it. I'll come back with the answer. It was type of delusion asked. So if it was type of delusion asked, then answer should be nihilistic delusion. But I'll come back on this. Let me figure out the exact question.
Dr. Praveen sir, you have 3 minutes more. Thank you very much.
Right, sir. A 35-year-old male presents to surgery emergency with painful persistent erection for last 7 hours. He has history of mood disorder and was recently prescribed a medication by a treating psychiatrist. Now, this is a simple question. I'm sure all of you must have gotten it correct. Yes. So the answer is trazodone. We all know that trazodone is associated with priapism, right? All right. Again, another simple question. Tactile hallucinations seen during intoxication with cocaine are called as, they're called as formication. Again, a simple question. Bupropion was in the options. Okay. Bupropion. Now this is simple. Both miltazepine and bupropion are the drugs which do not cause sexual side effect. Tactile hallucinations seen during intoxication with cocaine are called as formication. Priapism word was there. Okay. But either way, the answer is trazodone. And then now this is an interesting question. A new drug approved for Rett syndrome. I'm sure Gobind sir will be talking about it soon. And trofinetide is the new drug approved for Rett syndrome. It is the first drug to be approved for Rett syndrome. Interesting thing is it was approved in March 2023. And they asked you about this drug in May 2023, right? So again, this is something that you should not be worried about. Such questions are asked in the exams and you're not supposed to know the answers. And don't give too much importance to these questions. So 8 questions. And I think 2 or 3 of them were tricky. I'll get back with the nihilistic illusion versus Cotard syndrome question. And that's it. Right. These were the psychiatry questions, students. And over to Dr. Apoorv Mehra.
Thank you, Dr. Praveen sir. Please let us see Devi Saraswati Ma at your behind. The reason for your success as a teacher. Friends, I would also like to share that sir has recently released a textbook of psychiatry, which is a bestseller. And if you want to do something like what he has done, keep Devi Saraswati Ma in your room. Now you have one of your favorites. In fact, the favorite, Goga sir. And Goga sir is nowadays busy featuring on Tanmay Bhatt's channel and for his quotes and statements. So you can catch him there as well. But right now he is on the job for pharma questions. So over to you, sir.
Thank you, Dr. Apoorv. And hi, students. I feel the students are saying that exam is a little difficult, but don't feel, because if it is difficult, it is difficult for everyone. So I will be discussing pharmacology question. I have got only 7-8 questions, some maybe 10 questions. And out of that, 4 has already been discussed by Dr. Praveen. So my job has become a little easier. So first question, lithium question, Dr. Praveen has already discussed. So fine tremors are normal within therapeutic range. Some of the option may be, sorry, screen has not been shared. Because if it is difficult for everyone. So I will be discussing pharmacology question. I have got 7-8 questions, some maybe 10 questions. And out of that, 4 has already been discussed by Dr. Praveen. So my job has become a little easy. Am I audible? Question, Dr. Praveen has already discussed. So, am I audible?
Yes, sir, you are audible, sir.
Please say yes or no in the chats. Am I audible?
Yes, you are audible.
कोई सुन ही नहीं रहा मेरे को. Chalo. I am going forward. So lithium we have already discussed. Dr. Praveen have already discussed. Tremors are normal at therapeutic range. Then next question: a lady with diabetes was given some oral drug, and that has reduced HbA1c little bit. And there is some option regarding GIP and GLP-1 levels. So they are talking about incretins. Incretins they are talking about. So I feel the question must be on gliptin. Which gliptin was given? You can give the answer. Any gliptin is given, that should be the answer. Amit, pharma portion is very tough. Yes, pharma seem to be tough. एक बार देख लेते हैं, जल्दी देख लेते हैं. So answer will be gliptin. Agree guys? चले आगे. लीराग्लूटाइड है, ये इंजेक्टेबल है, टाइड है इस ऑप्शन में. मेटफॉर्मिन तो करते ही नहीं है इन पे काम. Boglivose was another option. Okay, I will add it on. Boglivose is another option. Leptin was option. I think leptin दूसरे में था यार. leptin तो जो उसका था. पूजा से ध्यान हटाओ सर, मेरा ध्यान नहीं है, तुम लोगों का ही ध्यान है. Allogliptin था ऑप्शन में. Okay, allogliptin was in the option. ठीक है. So answer is gliptin only. जो भी gliptin है. Pramlintide was in option. चलो pramlintide भी लिख लेते हैं. Okay. चलिए नेक्स्ट क्वेश्चन पे चलते हैं. ये तो इजी है. लेडी विद वल्वा वजाइनल प्लूराइटिस ऑन एंटीडायबिटिक ड्रग, व्हिच ड्रग मस्ट हैव कॉज्ड. ठीक है. तो UTIs and urinary tract infections and genital tract infections, they are common with the ग्लिफ्लोजेंस हमने नाम में पढ़ी लिखा था ग्लूकोज फ्लोज इन यूरिन, जब यूरिन में ग्लूकोज आ जाएगा तो देर विल बी बैक्टीरिया टू ईट देम, देर विल बी इन्फेक्शन, सो वल्वोवाजिनल प्रोराइटिस मोस्ट लाइकली इट विल बी कैनाग्लिफ्लोजिन। ओके, तो बाकी ऑप्शंस कोई भी हो यू कैन टेल मी, हम बाद में डिस्कस कर लेंगे। लीराग्लुटाइड, प्रेमलेंटाइड, एलोग्लिप्टिन, वॉब्लिवोस। ओके, लीराग्लिप्टिन, लीराग्लुटाइड, ठीक है, ये चार ऑप्शन मैंने लिख लिया भाई, कर दूंगा मैं। ठीक है, FVS एंड PP2BS, SGLT2 इनहिबिटर, यस यस, ठीक है, ये इजी हो गया। कैनाग्लिफ्लोजिन इज द आंसर। नेक्स्ट क्वेश्चन, न्यू अप्रूव्ड मोनोक्लोनल एंटीबॉडी फॉर रेट सिंड्रोम। किसी स्टूडेंट ने भेजा था, ट्रोफेनाटाइड करके समथिंग, ट्रोफाइनटाइड है, फाइन है, फाइन FINE, ठीक है। तो दिस इज द न्यू ड्रग फॉर रेट सिंड्रोम, ठीक है। मैं न्यू ड्रग्स किसी को भी याद करने को रेकमेंड करता नहीं हूँ, बट लेटेस्ट वाली जो 2-3 होती हैं, इफ यू कैन रिमेंबर इट्स ओके, इफ यू कैन नॉट रिमेंबर लीव दैट, नॉट दैट इंपॉर्टेंट। ओके, सो ट्रोफाइनटाइड करके दवाई है, ट्रोफाइनटाइड, ओके, रेट सिंड्रोम के लिए न्यू ड्रग है, डॉक्टर प्रवीण ने ऑलरेडी डिस्कस कर लिया ये दवाई। नेक्स्ट क्वेश्चन वाज ऑन कीनोट ट्रायल। I will want a little bit information from you on this. Have they numbered some keynote trial? Because plenty of keynote trials are going on. For UTI option were canagliflozin, acarbose, sitagliptin. Okay, canagliflozin, acarbose, sitagliptin. Okay, ठीक है, यूटीआई वाला ट्रोफाइनटाइड, ठीक है, वो हो गया आपका। इस क्वेश्चन में आप मुझे बताओ कि जो कीनोट ट्रायल लिखा था, हैड दे गिवन एनी नंबर फॉर कीनोट ट्रायल, बिकॉज मेनी ट्रायल्स आर गोइंग ऑन। अच्छा, 189, ओके। तो दिस इज मतलब बकवास क्वेश्चन आई विल से, कि पहली बात तो ट्रायल है और उतने सारे ट्रायल चल रहे हैं, और उसके में भी एक पर्टिकुलर नंबर के ट्रायल पे दे रखा है। आई टू नीड टू चेक, बिकॉज कीनोट ट्रायल्स आर ट्रायल्स ऑफ पेम्ब्रोलिजुमैब इन नॉन स्मॉल सेल कार्सिनोमा, ठीक है, एंड इन सम ट्रायल्स दे आर कंपेयरिंग पेम्ब्रोलिजुमैब अलोन विद द कीमोथेरेपी, एंड इन सम ट्रायल्स दे आर कंपेयरिंग पेम्ब्रोलिजुमैब इन एडिशन टू कीमोथेरेपी। तो आई डोंट रिमेंबर कि 189 वाला कौन सा है, विद कीमोथेरेपी वाला है, विदाउट कीमोथेरेपी वाला है। सो आंसर विल बी पेम्ब्रोलिजुमैब ओनली। 189 आई नीड टू चेक कि 189 वाले में विद कीमोथेरेपी है या विदाउट कीमोथेरेपी है। ओके, तो नो नीड टू रिमेंबर सच क्वेश्चंस, फालतू के क्वेश्चंस होते हैं, छोड़ देना चाहिए बिल्कुल। अर्जुन हैड डन बेस्ट, लेफ्ट दिस क्वेश्चन, ठीक। ये तो आया था, आसान क्वेश्चन था क्या, इसमें कुछ कैच था? मॉर्फिन नैलोक्सोन, इजी क्वेश्चन, और देयर एनी कैच इन दिस क्वेश्चन? लेफ्ट, बढ़िया किया आपने यार, शिवांगी, अर्जुन, सबने अच्छा किया। मॉर्फिन एंटीडोट वाला डायरेक्ट क्वेश्चन था, एनी कैच वाज देयर? गिवन मेटा, यार वो सारा मेटा अनु, इट इज ऑल रिगार्डिंग द मेटास्टैटिक नॉन स्मॉल सेल लंग कैंसर ओनली, पेम्ब्रोलिजुमैब इन लंग कैंसर, बट सम वर विद एंड सम वर विदाउट, ठीक है, इजी था। अच्छा, ठीक है, ये इजी था, एट्रोपिन ऑप्शन में था, और कोई भी ऑप्शंस में होंगे, नैलोक्सोन वाले ऑप्शन में एट्रोपिन या कुछ भी होगा, तो इट वाज इजी क्वेश्चन, डायरेक्ट क्वेश्चन था मॉर्फिन पॉइजनिंग का। दे आस्क्ड रिवर्स इफेक्ट, हाँ, जो एक ही बात होगी, कौन सी दवाई इफेक्ट रिवर्स करेगी, तो दैट इज इजी, नैलोक्सोन हो जाएगा उसका। ये डॉक्टर प्रवीण ने ऑलरेडी डिस्कस कर ही लिया। ओपियम गिवन, सिम्टम्स गिवन, ओके, ओपियम के सिम्टम्स गिवन थे, तो उसके बाद पूछा था रिवर्स कौन करेगा, ठीक है, गुड। मॉर्फिन वाला सीधा हो गया, ठीक है, स्टोरी था पूरा, ओके। चलिए नेक्स्ट क्वेश्चन, रेयर बट सीरियस साइड इफेक्ट ऑफ क्लोजापिन, जो डॉक्टर प्रवीण ने ऑलरेडी डिस्कस कर ही लिया है, ग्रेनुलोसाइटोसिस उसमें आंसर है। गूगल करा था, इट्स पेम्ब्रो प्लस कीमो, ठीक है। 189 जो है फिर कीमो वाला होगा। थैंक यू मृणाल फॉर हेल्पिंग मी, ठीक है। पैथिडिन वाज इन द ऑप्शन, तो ठीक है, पैथिडिन तो खुद ही ओपियोइड है, पैथिडिन वाज इन द ऑप्शन, ओके। पोस्ट मॉर्फिन गिवन डबल पिन पॉइंट प्यूपल भी हो गया, तो सिम्टम आ गया ना बेसिकली, ठीक है। मॉर्फिन हो गया भाई, आगे चलते हैं, करीमा आते हैं, किड्स टेम्पल वाले पे भी आते हैं, तो ये ग्रेनुलोसाइटिस ऑलरेडी डिस्कस हो गया। नेक्स्ट क्वेश्चन, ये थोड़ा सा बता दो यार मुझे, क्लिनिकल थेरापेटिक इंडेक्स पे कोई क्वेश्चन था, क्लिनिकल थेरापेटिक इंडेक्स। एक तो ऑप्शन थेरापेटिक इंडेक्स इज LD50 बाई ED50 करके ऐसी था, ठीक है, और क्या था इसमें? वन ऑप्शन, समवन सेड मी देयर इज, इट इज अ डोज इन विच एफिकेसी एंड टॉक्सिसिटी कैन बी बैलेंस्ड इन एन इंडिविजुअल। क्वेश्चन 7 में पूरा स्टोरी था, हाँ ठीक है भाई, मॉर्फिन हो गया, उसको छोड़ दो, मॉर्फिन इज इजी, मॉर्फिन पॉइजनिंग होगी तो इजी है। इसके ऑप्शंस अगर आप बता सकते हो तो प्लीज। डोज इन विच एफिकेसी एंड टॉक्सिसिटी कैन बी बैलेंस्ड इन एन इंडिविजुअल था। ओके ओके, इंडिविजुअल एंड पॉपुलेशन। आंसर इजी था, थेरापेटिक इंडेक्स इज LD50/D50 करके था, सेंटेंस लिखा था फार्मूला को, ठीक है वो। ओके, सेंटेंस लिखा था, फार्मूला को समझ गया मैं। फॉर पर्सन और फॉर इंडिविजुअल, पर्सन और इंडिविजुअल तो एक ही बात होता है, पॉपुलेशन और इंडिविजुअल होगा। बहुत बड़ा ऑप्शन था। इनवर्ड्स ऑप्शंस वर मेड विद सेफ्टी एंड एफिकेसी, बाकी ऑप्शंस डोज रेंज पे थे, बाकी रॉन्ग स्टेटमेंट था। चलो ठीक है, बाकी रॉन्ग स्टेटमेंट था तो ऑप्शंस मतलब फाइनली यू कम टू नो कि LD50/D50 ही पूछा है डेफिनेशन करके। ओके ठीक है, ये तो आसान क्वेश्चन था। इस क्वेश्चन को मुश्किल कौन कर रहा है यार? HER2 पॉजिटिव ट्रास्टुजिमाब रेजिस्टेंट ब्रेस्ट कैंसर की ट्रीटमेंट, हु इज सेइंग दिस क्वेश्चन इज डिफिकल्ट? सर सेम जो आपने लिखा, पॉपुलेशन देन इंडिविजुअल। ओके, पॉपुलेशन एंड इंडिविजुअल वाला था ना थेरेपेटिक इंडेक्स वाला, तो आई विल चेक टू दैट, बट आंसर तो इजी है। चलो 9th क्वेश्चन पे आते हैं भाई जल्दी। HER2 पॉजिटिव ट्रास्टुजिमाब रेजिस्टेंट ब्रेस्ट कैंसर की ट्रीटमेंट पूछा था, तो इसमें तो बहुत इजी क्वेश्चन था। हमने बताया था ना कि लंप कहाँ होता है, ब्रेस्ट में होता है, तो लंप ब्रेस्ट में होता है, तो लापाटिनिब ब्रेस्ट कैंसर के लिए है। HCC वाले को हम सॉरी बोल देते थे, हेपेटोसेलुलर कार्सिनोमा के लिए सोराफेनिब है, HCC को सॉरी बोल दिया। मैलिग्नेंट मेलानोमा वालों को DVT हो जाता है, बेमुराफेनिब इज फॉर DVT, ठीक है। और ECG कराते हैं लंग कैंसर से पहले, तो अर्लोटिनिब इज फॉर लंग कैंसर। तो दीज आर दी मेन 5-7 तो बताए थे मैंने थोड़े से, तो लापाटिनिब इज इजी वन, ठीक है, ये मुश्किल नहीं है। विज़्मोडैगिव था, विज़्मोडैगिव तो उसके लिए यूज करते हैं यार, I forgot, कुटेनियस कैंसर के लिए शायद है, जो फैक्टर इनहिबिटर है ये, ठीक। तो ये सोराफिनिब की जगह विज़्मोडैगिव होगा ये, ठीक है, बट आंसर वाज लापाटिनिब, इजी था, ठीक है। इसमें ये क्या क्वेश्चन था भाई? वैंकोमाइसिन डोजिंग के लिए स्केल यूज्ड की, व्हाट वाज द क्वेश्चन, व्हाट वाज द ऑप्शंस? वन इंडिविजुअल था, सेम ऑप्शन पॉपुलेशन करके था। ओके ओके, आई विल चेक एंड लेट यू। हाँ, बेसल सेल कार्सिनोमा के लिए श्लोक इज राइट। स्केल यूज्ड, ये क्वेश्चन बताओ यार क्या है? स्केल यूज्ड फॉर वैंकोमाइसिन डोजिंग, क्या क्वेश्चन था? की सही हो गया, तुक्का तुक्का नहीं है यार, ये सही है। नोमोग्राम फॉर वैंकोमाइसिन, क्या क्वेश्चन क्या था ये तो बताओ भाई। नोमोग्राम वैंकोमाइसिन यही सब लिखे जा रहे हैं, क्वेश्चन क्या पूछा था? क्वेश्चन क्या था? मतलब डोंट नो ऑप्शन तो समझ आएगा, बट व्हाट वाज द क्वेश्चन? इन क्लेसोमाइडेड सुसाइडल टेंडेंसीज, ठीक है जी, ओके। नेम ऑफ स्केल यूज्ड फॉर डोजिंग, हाफ रेड होम्स, नोमोग्राम स्केल, नोमोग्राम यूज्ड फॉर वैंकोमाइसिन यूजेस। भाई मुझे ऑप्शंस ही नहीं बताओगे तो कैसे बताऊंगा? सो आई विल सर्च हाल्स्टेड स्केल। अच्छा, हाल्स्टेड स्केल वैंकोमाइसिन वाले भी हाल्स्टेड स्केल कह रहे हैं और भूल गए सालाजार स्केल। भाई मुझे भी नहीं आता ये बिल्कुल भी, इवन आई डोंट नो अबाउट दिस, ठीक है। नोमोग्राम स्केल पूछा था, उसका नाम पूछा था, बेसिकली क्या कहते हैं ये पूछा था ना, ठीक है। नेम ऑफ स्केल यूज्ड फॉर डोजिंग ऑफ वैंकोमाइसिन, ठीक है ठीक है, आई विल चेक एंड लेट यू नो। मुझे खुद नहीं आता ये क्वेश्चन। किड्स को था एक, किड्स को, ठीक है, आई विल चेक एंड लेट यू नो, ओके। सालाजार, ठीक है, चलो ठीक है। मार्टजे स्केल भी होगा, चलो चारों ऑप्शंस बन गए मेरे पास। आई विल चेक फॉर अमंग दीस। ये वाला क्वेश्चन जो बार बार मंदिर वाला, हाल्स्टेड, हॉल एंड सालाजार, ठीक है, हो गया। चलो ये क्वेश्चन, A kid went to temple with grandmother constantly crying, BP, ऑप्शंस, क्वेश्चन ठीक है, पहले ये बता दो। हॉल एंड मैटे, हॉल एंड सुरूबी, हॉल एंड मैटे, हॉल एंड सुरूबी। फोर्थ ऑप्शन मिथाइल प्रेडनिसोलोन, ओके। 11th फोर्थ ऑप्शन मिथाइल प्रेडनिसोलोन, ठीक है। ये स्कॉर्पियन स्टिंग लग रहा है मोस्ट लाइकली। पेशेंट विल सस्टेन्ड प्राइपेजम फॉर 7 hours, यार वो तो अलग था ट्रेजोडोन वाला। सस्टेन्ड प्रायापिज्म ट्राइजोडोन अलग था ना, सस्टेन्ड प्रायापिज्म 7 आवर्स ट्राइजोडोन, ये राज भी उसी के साथ चला गया प्रीवियस क्वेश्चन। इनकंसोलेबल क्राइंग वो हो गया, ठीक है। ये तो प्राइजोसिन है, ऑटोनॉमिक स्टॉर्म के सिम्टम्स हैं, टेम्पल वाला प्रायापिज्म वाज देयर, हाइपोटेंशन था शायद, हाँ मेरे ख्याल से भी हाइपोटेंशन विल बी द बेटर थिंग। क्या बीपी 150/90 था? स्कॉर्पियन बाइट था ये, सेम क्वेश्चन, स्वेटिंग नो प्रायापिज्म वाज गिवन। ओके, प्रायापिज्म नहीं था इसमें, 11th क्वेश्चन में नो प्रायापिज्म, वो अलग क्वेश्चन था। ओके, स्वेटिंग मतलब ये बेसिकली डायरेक्ट क्वेश्चन था स्कॉर्पियन स्टिंग वाला ना, ट्राइजोडोन अलग था, ठीक है। ये स्कॉर्पियन स्टिंग वाला था सिंपल, टेम्पल ऑन वे वैक्स सिम्पटम पेल स्किन वाले हाइपोटेंशन। ओके ओके ठीक है, तो प्राइजोसिन विल बी द आंसर, बोला हो जाएगा आपका। ओके, हाइपरटेंशन, टैकीकार्डिया, हाई बीपी था, कोलिनर्जिक है, कोलिनर्जिक सिम्टम्स भी थे, इसमें भी प्रायापिज्म था। पैरासिम्पैथेटिक फॉलोड नहीं समझ आ रहा, नेम वाज आस्क्ड ऑफ वैंकोमस नोमोनम, वो हो गया यार। सेलिब्रेटिंग चाइल्ड एंड कोल्ड हैंड्स, इसमें ऑप्शंस बताओ, एड्रेनालिन, एंटी स्नेक वेनम, प्राइजोसिन। स्नेक और एड्रेनालिन तो वैसे नहीं बनता, और मेथाइलप्रेडनिसोलोन भी बनता, तो आंसर तो प्राइजोसिन ही आएगा। इसका प्राइजोसिन ही आंसर होगा यार, जो मर्जी कर लो, ठीक है। तो इफ यू रिमेंबर एनी मोर क्वेश्चंस प्लीज लेट मी नो। टू डिफरेंट क्वेश्चंस, प्राइजोसिन एंड ट्राइजोडोन, ठीक है, गॉट इट। ट्राइजोडोन का अलग से क्वेश्चन हो गया, आई गॉट इट। ट्राइजोडोन प्रायापिज्म वाला 7 आवर्स वाला प्रायापिज्म वाला हो गया ट्राइजोडोन। एनी मोर क्वेश्चंस यू रिमेंबर? ER पॉजिटिव हो गया यार, लेपेटिनिव आंसर हो गया। ये सर कोल्ड क्लेमी स्किन, बीपी 170/90, हार्ट रेट 110 बीट्स पर मिनट, कांस्टेंट डिक्लाइन, ठीक है, यही सब तो लिखा है। इसके आंसर है विकिपीडिया पे, प्रेडनिसोलोन लास्ट ऑप्शन। लास्ट ऑप्शन प्रेडनिसोलोन मैंने कर दिया यार, इसमें प्रेडनिसोलोन कर दिया मैंने, इसमें लास्ट ऑप्शन प्रेडनिसोलोन, मिथाइल प्रेडनिसोलोन कर दिया। बीटा ब्लॉकर मैच दी फॉलोइंग, बता दो यार साकरू, प्लीज लेट मी नो, बीटा ब्लॉकर मैच दी फॉलोइंग क्या था? मैच वायरल निमोनिया में ड्रग ऑफ चॉइस पिक्स था, मीरा बैकग्राउंड मैच फॉलोइंग विद बीटा रिसेप्टर। मीरा बैकग्राउंड पे भी, मतलब मैच वाले में से ये था, मीरा बैकग्राउंड ही था, इसी में था। मैच द फॉलोइंग बीटा 3 रिसेप्टर वाला था, बीटा 1 2 3 4 रिसेप्टर, बीटा 4 कहां से आ गया भाई? बिटॉक्सोलोल मीरा बैकग्राउंड, बिटॉक्सो मीरा बैकग्राउंड, और क्या है? आइसोप्रेडनिलोन, ठीक है। अल्कोहल प्रेडनिलोन, नो कंफ्यूजन, टॉकिंग वेल। बीटा ब्लॉकर क्वेश्चन मैच था, आइसोप्रेडनिलोन, बिटॉक्सोलोल, बीटा 1 2 3, ठीक है, ये वाला क्वेश्चन हो गया। अगर बीटा 3 मीरा बैकग्राउंड है तो वो तो सबको याद ही है ना, मेरा ब्लैडरगॉन हमने पढ़ा था, बिटॉक्सोलोल भी था। अच्छा, बिटॉक्सोलोल को लिख दिया। एंटीसाइकोटिक प्राइपिज्म हो गया, हो गया, दिस क्वेश्चन हैज बीन डन। मीरा बैकग्राउंड हो गया, ओके। न्यू क्वेश्चन, अल्कोहल प्लस रेड आई प्लस नो कंफ्यूजन, टॉकिंग वेल, नो वेडलिंग गेट, इज ही अंडर इफेक्ट ऑफ अल्कोहल? या ये तो डॉक्टर परवीन बताएंगे आपको, ठीक है। अगर कंफ्यूजन नहीं है, रेड आई तो वैसी हो जाती है भाई। बाकी डॉक्टर टिकार्सिलिन टैजोबैक्टम प्लस सिप्रोफ्लोक्सिन यूज्ड फॉर, ओके, टिकार्सिलिन टैजोबैक्टम प्लस सिप्रोफ्लोक्सिन, ये तो सूडोमोनास आएगा यार। टिकार्सिलिन टैजोबैक्टम प्लस सिप्रोफ्लोक्सिन यूज्ड फॉर, ये दोनों सूडोमोनास के लिए इफेक्टिव हैं। अगर कोट्राइमोक्साजोल ऑप्शन होगा तो उसमें आएगा कोट्राइमोक्साजोल इज फॉर बर्कोल्डेरिया स्पेशिया। वन लॉन्ग केस विद ल्यूकोसाइटोसिस, एक मिनट, ल्यूकोसाइटोसिस, WBC इज रेज्ड है, एक्सरे इमेज गिवन, एक्सरे गिवन, एडमिटेड इन ICU, एडमिटेड। भाई एक्सरे में क्या था पहले ये तो बताओ, निमोनिया था क्या सिंपल? सेफ्ट्रायोक्सोन प्लस अजिथ्रोमाइसिन, क्वेश्चन चला गया भाई, हाँ। सेफिक्सिम प्लस लिवोफ्लॉक्सासिन, पिप्टेस, ये तो आपको मेडिसिन वाले बनाएंगे यार, पहले क्वेश्चन का डायग्नोसिस बनाना पड़ेगा हमें। साइक्लोस्पोरिन अब्जॉर्प्शन, साइक्लोस्पोरिन इनहिबिट विच रिसेप्टर, ये भी आया था क्वेश्चन। साइक्लोस्पोरिन साइक्लोस्पोरिन पे क्वेश्चन था गाइस, साइक्लोस्पोरिन। सिप्रोफ्लोक्सेशन कर ले, क्वेश्चन था। बिटैक्सोलोल वाला हमने डिस्कस कर लिया भाई। साइक्लोस्पोरिन वाला बताओ मेरे को जल्दी। साइक्लोस्पोरिन पे क्वेश्चन था क्या? डायरेक्ट मैकेनिज्म ऑफ एक्शन पे क्वेश्चन था क्या? डॉग बाइट, पंकज डॉग वाज इम्यूनाइज्ड बट हैज टू, वो डॉग बाइट वाले में तो वही आ जाएगा यार, सिंपल अमोक्सिक्लेव। डॉग बाइट में अमोक्सिक्लेव आ जाएगा सिंपल। साइक्लोस्पोरिन इंड्यूस्ड कोलिस्टेसिस, इसमें क्या क्वेश्चन था यार? साइक्लोस्पोरिन इंड्यूस्ड कोलिस्टेसिस। अच्छा एमडीआर इनहिबिटर होगा। अच्छा वो तो एमडीआर वाला हो जाएगा, पी ग्लाइकोप्रोटीन वाला। अनिसुर वो डॉग वाइट वाले में अपना ये हो जाएगा अमोक्सिक्लेव। थैलिडोमाइड का मैकेनिज्म ऑफ एक्शन पूछा था, प्लीज थैलिडोमाइड वाले ऑप्शन बता दो प्लीज। थैलिडोमाइड मैकेनिज्म ऑफ एक्शन पूछा था, बता दो। एक तो एंजियोजेनेसिस इनहिबिटर है थैलिडोमाइड, एक टीएनएफ अल्फा इनहिबिटर है। एनी वन ऑफ देम वाज देयर? इन दोनों में से कुछ था? पेपर बहुत 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 टफ था। कोई बात नहीं यार, टफ था जैसे सबके लिए था ना वो तो। नो सर, उसमें हिस्ट्री ऑफ डॉग बाइट है, फ्यू इयर्स अगो स्पेक्ट्रमी ऑल वैक्सीन ऑफ डॉग। थैलिडोमाइड मैकेनिज्म ऑफ एक्शन के ऑप्शंस तो बता दो भाई। एमआरसीपी, एक्सोन, इंटरलुकिन 245। ये कौन है इंटरलुकिन 245? कौन किस क्वेश्चन के हैं भाई ऑप्शंस? एंटी एंजियोजेनेसिस था ऑप्शन में, तो एंजियोजेनेसिस वाला आ गया, एंजियोजेनेसिस इनहिबिटर। चलो आई थिंक आई एम टेकिंग टाइम ऑफ अदर पीपल हियर, तो मैं आपको ऐसा करता हूं, मेरे को ये व्हाट्सएप कर देना, वी विल डिस्कस पर्सनली। दिस इज माय नंबर, प्लीज व्हाट्सएप ऑन दिस नंबर, तो वी विल डिस्कस द क्वेश्चन व्हाट्सएप पे, ठीक है? तो अदरवाइज डॉक्टर अपूर मेरे को भगा देंगे यहाँ से।
नहीं सर, वो पर्सनली ऑन द व्हाट्सएप शेयर द लिंक, प्लीज शेयर द लिंक ऑफ दैट वीडियो सर जो आपने शेयर किया था। एंड द स्टूडेंट्स आर आस्किंग सर, विल यू बी शेयरिंग द पीडीएफ आल्सो?
किस चीज का?
सर किसी भी चीज का पीडीएफ आपके पास हो तो।
मेरे पास जो भी पीडीएफ मैं शेयर कर दूंगा यार, क्या दिक्कत?
Sir, thank you sir. So we are very happy and thank you Goga bhai for joining at the last minute and getting the questions ready. You are the best. And now we have
थैंक यू अपूर।
one of my favorite couples in the nation. Do you guys have a combined name or something, Amrit and Janvi? Or it's the real doc that's become the combo here?
So the combined name is Janam.
Okay, fantastic. बहुत ही प्लेजेंट नेम रखा है आपने, और उसमें भी आपने अपने आप को पूरा कंट्रोल करके बेचारे को जगह दे दी है थोड़ी सी।
तो उसमें तो कोई डाउट ही नहीं है।
बट इस समय स्क्रीन पे कवर आपने किया हुआ है अमृत, सो ओवर टू यू।
Thank you so much, sir. So, in my opinion, I think I have all the questions of surgery. Maybe not the options, but questions definitely, most of them. And I don't feel this was an INICET standard question paper for surgery at least. I saw Goga sir's questions. Of course, Pharmac was very tough, no doubt about it. But I don't think surgery was the toughest. Please correct me if I'm wrong. And try to, as we go along, let's not discuss, let's just come to the answer, come to the point. So there was one question, which of these, it was multiple correct answers. The question was on breast conservation therapy. And one of the incorrect statement was radiotherapy is not a must. That was the odd one out. But the options were 1, 2, 1, 2, 3, 1, 2, 3, 4. So jisme radiotherapy was the answer, that is the odd one out. So the other three were correct, right? Because radiotherapy, of course, is a part of ECT, no doubt about it. Even one question was easy, it was on PVD. You can help me with the option. So there was a patient who had intermittent claudication at some location, and they had asked what is the incorrect statement. And one of the clear-cut options were level of occlusion cannot be decided on symptoms. But you know, level of occlusion can be decided on symptoms. Like if the block is in the thigh, then intermittent claudication will be in the calf. So based on the occlusion, you come to know the symptoms, right? So I'm getting some options: wide local accession, axillary dissection. Thank you so much. Of course, they are parts: wide local accession, axillary dissection, or sentinel lymph node biopsy. One of the two is going to be done. So they are all parts. Right. So radiotherapy is a must. All right. If that was the one, that is the odd one out. Extended breast cancer lesion removal. Okay. Then breast pain at night is seen. So yeah, thank you. Breast pain will be seen in severe cases. Pain after taking first step is not seen. That is the incorrect one. So pain is not on first step. Okay, it's not on first step. Even this is incorrect. All right. So all these are incorrect statements. Pain on first step is seen in neurogenic causes. Then this was the third question, where they had given an image of different locations of the appendix, and they had asked you the name, like they had matched what is this location called, what is this location called, what is this location called. So they had asked you position 1, retrocecal. So it is actually an anatomy cum surgery question. It is combined. So based on the location, you had to know the answer. That was easy, straightforward. Rest pain at night. Rest pain is not seen at night. Rest pain is seen all the time. Okay, night pain is not seen. If it was night pain, that is incorrect. Night pain is not seen. There is nothing like night pain. Rest pain will be seen throughout. Most common cause is atheroma. That is correct. Atherosclerosis is the most common cause. Right. This is easy. Subcecal, paracecal. Whatever is below will be subcecal. Whatever is around will be paracecal. Paracecal करके इतना common नहीं होता. Okay. Paracecal भी था. That's fine. The locations are straightforward. I don't think this is very difficult. And you have to match the locations. All right, this is a repeat question. This has been asked before. This is a PYQ direct repeat, so nothing to discuss here. Which of these is not a perineal approach for rectal prolapse? You know the mnemonic also. Answer is Ripstein. Ripstein is abdominal. Right. Others are all perineal approaches which are preferred in elderly. This Zainab ma'am has already discussed. There was an ultrasound image of a gallbladder anomaly. Answer was Phrygian cap. Phrygian cap is not pre-malignant. This also Dr. Zainab has discussed. So there was an MRCP. There were some filling defects that were seen, or probably, and the answer should be choledocholitis. All right. They would not give you any of the other options. Unlikely. This was an interesting question, but not the most difficult. There was some clinical scenario given. Patient is an elderly male. He is coming with bleeding PR. Bleeding PR, elderly male, you will think about colorectal cancer. So the scenario was suggestive of colorectal cancer. Which of these is not going to be done? So which of these is not going to be done? Answer is CA19-9. Okay, CA19-9 is seen in cholangiocarcinomas. Right. That was cholangiocarcinomas. So there were combinations. Which of these will be done? Now, of course, you will do CA. CA is a marker for colorectal cancers. You will do colonoscopy. You will do CT for metastasis. Right. Okay, I'm getting some options here for Phrygian cap. Yeah, they were easy options. Floating gallbladder, all GB polyp, they are also not going to be seen. So nothing too difficult. This question I don't have a proper recall of, but I hope you can help me over here. Patient had some urinary tract complaints. I think there should be hematuria, but I was told categorically that there was dysuria. Right? There was dysuria and some other symptoms, and there was a KUB image given. Probably it had radiopacities in the area of the kidney or the ureter. And they had given you what all disorders can lead to this. And the correct answer, I think, should be PTH adenoma, because that will cause primary hyperparathyroidism. I was told the others were syndromes. Right? The others were syndromes. That's what I was told. Colorectal cancer, CA, yes, it's a part of diagnostic protocol. Right? It's a part of diagnostic protocol. Yeah, dysuria and back pain. Okay, wonderful. So the best answer here will be PTH adenoma as a cause of primary hyperparathyroidism. Whether there are stones or calcifications, you can get both. Nephrocalcinosis also can be seen, and primary stones also can be seen. It is not going to be Wilms's tumor. Okay, Wilms's tumor is not going to be seen. Okay, wonderful. So this was straightforward, but one of the tricky questions was this. Otherwise, the surgery questions were quite easy. This was a very debated question. This was the first question, the recall of which I was given. They were like, sir, this was the question we could not understand. It's not that difficult. There were two hernia images given. First was before reduction, other was after reduction. Irrespectively, what you saw was there was a sac and there were contents outside the sac. Contents outside the defect means outside the, which are not contents within the sac. They are outside. If they are outside, it's a sliding hernia. Okay. If the contents or a part of the content is outside, like here you can see it is cecum, urinary bladder, sigmoid colon. If they are outside the sac, they have slid with the sac. So that is going to be sliding hernia. All right. So one was reduction. After reduction, some contents were still inside. They are actually not contents. They are part of the wall. Okay. So two images on hernia. Answer is sliding hernia. This is not debatable. This was straightforward. If the contents are still remaining there. Okay, sac got inverted, but contents didn't get reduced. Yeah, that is seen in sliding because part of the contents are outside. See, it cannot be incarcerated. In incarceration, sac also will not go back. If contents are not going back, how will the sac get reduced? So it cannot be incarcerated. Okay. Yeah, exactly. They were just pushed without force. Even better. Question was forcefully sac was reduced, but content was not reduced. See, it depends on the clinical scenario that is given. Two things are possible. Content outside, then it is sliding hernia. Contents are irreducible, then it's an irreducible hernia. If contents go back inside, that is reduction en masse. In en masse, the contents go back. Forcibly reduced. The contents go back inside. If they have gone back inside, then it is reduction en masse. Where it's an irreducible hernia, but you forcibly push the content back inside. Then nothing should be seen outside the defect. But what you should see is the contents which have gone in, there should be a constricting ring at the site. So if this was the content and I forcibly pushed it inside, the constricting ring on the defect should be seen. So the content should have a narrowing. If there was a narrowing seen, then it is reduction en masse. But I feel they would not put a scenario like that. It is too complicated. I don't feel. Okay. Anyways, moving on. Straightforward question. Patient had bleeding in stools or dysentery 6 weeks back. Now he has right upper abdominal pain. They had given some USG description of some liver SOL. Okay. They have given some liver SOL and some description, hyperechoic, hypoechoic. So the answer there will be amoebic liver abscess. History of amoebiasis is this. Okay, it is not going to be anything else. Okay, if contents went back, then it is reduction en masse. But if there is a constricting ring which is seen. Okay, that's what you guys are saying. Okay, reduction en masse, good. If there was a constricting ring. Okay. This is a more final MBBS type of a question. So they had given some scenario of varicose veins. And had they asked test for varicose veins or only test for SFG incompetence? Because the answers will change. All right. So was it SFG incompetence test or was it test for varicose veins? Because both answers are going to be different. So if the question was only for varicose veins, okay, if the question was only for varicose veins, then the answer is going to be Trendelenburg and Morrissey. Perthes test is a test for DVT and Fagan's test is a test for perforators. Okay, it's a test for perforators. Fagan's test is not going to be in the answer. So the answer will be Trendelenburg and Morrissey's cough impulse, not Fagan's and the other tests of, because they are just tests for varicosities. They are not tests for SFG incompetence. All right, so yeah, that most of you are saying SFG incompetence. Okay. Straightforward question. There was an image in the floor of the mouth. Had they given anything about fluctuation or transillumination? Even if they hadn't, the answer here straightforward. This is a ranula. Cystic hygroma is in the neck, posterior triangle of neck. All right, one option I think was dermoid. So this is straightforward. Liver abscess, fever bhi tha, USG irregular. See, if they have given you history of dysentery, then it cannot be pyogenic. Pyogenic is going to be a sequelae to ascending cholangitis. That is the most common cause. So it should be amoebic liver abscess. If they have given you the history of dysentery, it is for this reason. Otherwise, they would not have asked for dysentery. I mean, yeah, normally it is not seen, but the fact that dysentery was given in the history, they want you to diagnose amoebic liver abscess, not pyogenic. Pyogenic is usually after ascending cholangitis. Okay, fourth option was branchial cyst. वो भी neck में ही होती है. So branchial cyst is also in the neck. Floor of the mouth are only these two, but since it was a clear swelling, it should be ranula. That's what most students said. This was easy question, general surgery, not a complication of TPN. Answer is aspiration. Obviously, aspiration will be seen in nasogastric fields. It's not going to be seen in TPN. Other options were related to technique or refeeding syndrome. All right. Then there was an image of a surgical instrument, again very standard. It looked like a hemostat, but it was right angle. So right angle hemostat is a mixture. All right, straightforward. Right angle hemostat is a mixture. All these others are very, very different. And again, this, I don't know if it has been discussed in pathology. Smoking is not a risk factor for. Obviously, answer will be fibroadenoma. All right, ductectasia, yes. Ductectasia, periductal mastitis. CA breast, low risk, but yes, Bailey says it is a risk. And fibroadenoma, of course, there is no risk. Smoking is not related. Fibroadenoma is seen in 15 to 30 years of age group. Hopefully, you would not have started to smoke at that age group. Right? So, answer is going to be fibroadenoma. Fibroadenoma and smoking are not related because it's a benign tumor. All right, and 15 to 25 age group. Which age group you should not be smoking. That's how I would have thought. Yeah, Monders is a risk associated. Monders is possible. All right. So those were the surgery recalls. Overall surgery, I feel, was easier compared to the previous year questions. All right, nothing hi-fi bile duct injury. So I don't think surgery questions should have been a problem this time. All right, if there are any mistakes, any recall that I have given inappropriately, improperly, you can let me know on my Instagram or Telegram. All right, risk factor pucha tha. So it is not going to be, the odd one out is going to be fibroadenoma. Otherwise, ductectasia, CA breast, Mondors are related to smoking, multiple correct, yes. So let me know if there was anything which requires correction, but I think surgery was very manageable. All the best to you guys. Over to you, Apurv sir. Thank you so much, sir.
So now comes the lady. कुर्सी से हटो, कुर्सी दो, सेट करो, झुको और क्लास स्टार्ट कराओ. अमृत, कॉफी लाओ, चाय लाओ, नाश्ता लाओ, खाना लाओ, मैम पढ़ाएंगे अब. The real doc. Over to you, Janvi.
Just one second. Which one? This one?
Okay. So anesthesia, typically only 2 questions were asked, and one of them was a straight off PYQ that we had. So that was about CPR. We've discussed this multiple times, and it was one of the easiest questions about CPR. Depth of chest compressions should be 5 to 6 centimeter. That is correct. You should allow adequate chest recoil. Correct, because the heart should fill during that chest recoil. So the heart fills in diastole. C was rate of chest compression should be 100 to 120 per minute. This was also absolutely correct. And D was the incorrect option, that is respiratory rate should be 20 to 25 per minute. So respiratory rate should be 1 breath every 6 seconds, or that comes up to 10 to 12 per minute. Okay, so that was the incorrect option. Now, this was one of the images that was shared with me. Actually, this will come in ENT and not in anesthesia. But because it had the word block, everyone was telling me, ki, you know, ma'am, ye anesthesia mein shayad discuss karna hai. So, if this was the exact image that was given at the lateral side of the nose, if they showed you that a needle was being pricked, then that is actually the anterior ethmoidal nerve block. Okay. If you're looking at infraorbital nerve block, then it will be somewhere between the medial 1/3 and the lateral 2/3 of the eye. And if you're looking at nasociliary nerve block, it will be somewhere on the medial canthus of the eye. Okay. But if it's going down from here near the nose, then that would be the anterior ethmoidal nerve. But I guess a few people are saying that it was the wrong image. Needle was above the medial canthus. Okay, so as I told you, if the needle was above the medial canthus, then it is nasociliary nerve block straight off. All right, and this will be discussed in ENT as well. Now, this was a question that I did not get completely. A lot of students said, "Ma'am, बहुत बड़ा question था." We had a very long question, and these options were given. So let's have a look at this. They said that there was a patient who was ventilated, okay, and this was his ABG. pH was 7.3, the PCO2 was 48, PO2 was 110, tidal volume was 480, and PEEP I think was 10 or something. What are the changes that you will do in the ventilatory settings? And these were the options that were given. Now, a lot of you, yeah, so that one is nasociliary nerve block by chance of majority. So let's come to this question now. So a lot of you were saying that, madam, we will reduce the FiO2, decrease the FiO2 in this question. Now, remember, when a patient is breathing normal room air, FiO2 will be around 21%, and the PO2 that you see on the ABG will be somewhere between 75 to 100. But if you're ventilating a patient, if you put him on the ventilator, then at that point, we always give more FiO2 than room air. Okay, you give a little more oxygen. So if suppose I'm giving 40% FiO2, the PO2 will also be higher. It will be more than 100. It will be 110. So that's okay. You will not change. You will not decrease the oxygen levels at any point in time. Okay. Second, what you can see over here is his PCO2. PCO2 is 48. Normal PCO2 is 35 to 45 mm of Hg. Okay. Here the PCO2 is higher side. It is 48. So to bring down the PCO2 level, we can do two things. Either you can increase the respiratory rate or you can increase the tidal volume. Now, in the option they had given decrease the respiratory rate. So that is gone. That is the wrong option. The other option they have given is increase the tidal volume. So if you increase the tidal volume, the extra carbon dioxide will get washed out. Okay, so according to me, that should be the answer. For those who are saying increase the PEEP, remember, normal PEEP that we give on ventilator is only between 5 to 8 centimeter of water. Even this PEEP of 12, 14, whatever is given in the options and in the question is absolutely incorrect. We don't keep so much of PEEP because this leads to hypotension in the patient. So according to me, this answer would be to increase the tidal volume. Even if the patient has acidosis, it could be because of the high PCO2. And you would do the same, increase the tidal volume. So only two questions from anesthesia. I'll just quickly correct this. I think this was not the image. So the image was of the syringe next to the medial canthus. So answer is nasociliary nerve block in that. And this was a PY. So that's it.
Thank you very much, Janvi.
Thank you, sir.
I have before we start with gynae obs, I have a few questions that I have to ask Dr. Zainab Vora.
Yes, sir. Please.
Dr. Zainab Vora, when you appeared in November 8, 2014, your rank was not that easy, not that good. How did you feel the paper was at that time when you walked out?
So if I tell you my mind frame before I answer your question, I'll tell you the difference in my mindset when I was entering the exam hall in November. I have told this to the students as well. I was very tensed about my own preparation, you know, like I had put a lot of pressure on my own self कि यार इतनी मेहनत करिए, rank खराब नहीं हो सकता, exam खराब नहीं हो सकता. So when I started doing the exam, you know, every question I was reading again and again to ensure कि सब ठीक तो जा रहा है, everything is going fine or not. And then my anatomy was terrible. मुझे रोना आता था anatomy देख के. So there were a few anat questions, and one of them was a pretty simple one on cranial foramina, which now I teach also. Very ironically, I teach anatomy to them, and it was something I didn't know. कि foramen ovale से क्या structures pass होते हैं. And I know when I say this, students are gonna be like कि इस पे rank 1 कैसे आ रहा है अगर आपको foramen ovale के structures नहीं पता. So when I trumped at that question, I was like, I don't think I'm getting a rank in this paper. When I choked on that question. And after that, my mind, started getting blocked, is what I still remember that feeling. And after the exam was over, when I was coming out, so there was this heaviness that, heaviness in my heart कि जो जिसका डर था वही हुआ. I got choked in a few questions. Cut to in the May attempt, when I went in, I already had a few backup seats. Like I had gotten an NIMHANS rank, so I knew that I wanted to do neurology in NIMHANS. So उस टाइम पे जब मैं एग्जाम देने गई, I went like there was nothing to lose, and even if I don't get selected, it's fine. So I went with a very different mindset, and that enabled me to use common sense and logic. And this is what I want to tell. And looking at the questions also, काफी questions ऐसे हैं जिसका आंसर किसी को एक्सपेक्टेड नहीं है कि आता होगा. लाइक अ फ्यू फार्मा क्वेश्चंस, वैनकोमाइसिन का जो नोमोग्राम का क्वेश्चन है, फ्यू ड्रग्स आल्सो व्हिच आर न्यू ड्रग्स. इट्स कंप्लीटली फाइन, एंड इट्स, यू गाइस हैव सीन दिस फर्स्ट टाइम, बट वी आर सीइंग इट ईयर ऑन ईयर कि ऐसे सवाल आते हैं. दे आस्क्ड हाफ लाइफ ऑफ लेट्रोजोल. तो ऐसी चीजें आती है, एंड इट डजंट चेंज योर रैंक, सो दैट इज द इनसाइट जो आई लर्न फ्रॉम माय ओन एक्सपीरियंस कि हमें 140 टारगेट करने हैं, राइट? 140 क्वेश्चंस which are doable. In this paper also you have to target those questions कि यार ये गलत नहीं होने चाहिए. बाकी crazy questions गलत होते हैं, सही होते हैं तो you do get a bonus, but गलत होने पे you don't lose a rank. So this is what you guys have to understand कि tough questions पे usually we end up focusing कि exam ही tough था इसलिए मेरा rank नहीं आया, and that is a very convenient defense mechanism. I know you don't want to hear this right now, but don't focus on these questions. उससे rank decide नहीं होता. You have to focus on the questions जो कि आपको सब कह रहे हैं कि ये सवाल आएगा और यही आता है, like clozapine question from psychiatry. और अगर रेडियो की बात करें तो MRCP question on stone, so you don't have to get these questions wrong. बाकी question पे stress नहीं लेना कि गलत हुए हैं, ऐसा crazy question आ गया, so that is what you have to now learn.
So Zainab, you ended up getting a fantastic rank after 6 months.
Yes, sir.
That itself shows that if you go and give your exam calm, it makes a difference. When people will be listening to this video, I hope most of you, your preparation stops right away and you get the result and you start working and you just become the co-consultants and the co-branch, co-clinicians. But if you look at this video and it helps you to prepare, there's always a ray of hope if you focus on the common things which are asked. Zainab during her talk was telling you, जो common है वो आता है तो आएगा. So that's what I've been telling. जो आया है, जब तुमको वो आएगा और तुमको ये समझ आएगा तभी तुम्हारा number आएगा. Now we come to a subject which I was, like you were scared of anatomy, I was scared of gynae-ops. We have Dr. Anna ma'am taking up gynae-ops questions. Ma'am, over to you, ma'am.
Hi everybody. So I'll just share my screen. Okay. So gynae-ops was also a little different than what we usually see. Okay, but then the topics were from the same areas. So those high yield areas are very important. So let's just quickly move on. The first question which I forgot was on white discharge, and this is a very, very oftenly asked question. So the question, the points which we had were white discharge, non-pruritic, okay, with lactobacilli. So lactobacilli is normally seen in discharge. Okay, I think the pH was also given here, acidic, that's normal pH. Okay, so this is a patient who is on oral contraceptive pills, and this is completely normal discharge. Okay, so the answer here would be normal discharge. Don't get confused by staining the undergarments yellow. Okay, so that was what was the confusing statement here. It remains normal discharge. The second question, again, this is a very high yield area, but this question was not an easy question. From what I got, it was a 15-year-old girl with primary amenorrhea. So breast was Tanner stage 2, pubic hair was present. Okay. and the vagina was blind, and there was virilization in the form of what was given was clitoromegaly, and the karyotype also is given 46XY. And one added thing which was given is normal testosterone. Now, if you're not able to figure this out, an easy way to do this is that, see, the secondary sexual characters are present and there is clitoromegaly. Okay, so when secondary sexual characters are present, we can rule out complete androgen insensitive syndrome because pubic hair would be absent in complete AIS. Swire syndrome also would not have secondary sexual characters. So pubic hair would not be present. So these two are out. What remains is 17 hydroxylase and 5 alpha reductase. 5 alpha reductase will have raised testosterone levels. So what I would give here, and if this is the correct question, okay, so there's a doubt in this whether question, I have all the parameters, this would be in favor of 17 hydroxylase deficiency or congenital adrenal hyperplasia, but male, in a male with a 46XY karyotype. So there's decreased realization in 17 hydroxylase 46XY. This was a tough question, it was not an easy question. Okay. Next, there's another question on primary amenorrhea. So all the high yield areas were covered. Primary amenorrhea, the workup should start. And this was, I think, a multiple choice question. Okay, so here we all know primary amenorrhea is defined as 13 years if there are no secondary sexual characters. So this would be a correct answer. And 15 years if there are secondary sexual characters present. So this would also be an answer. Okay, these two should be the correct options. I'm not sure what the questions were, but usually after thelarche, that means breast development, menarche starts by 2 to 3 years. So this could also be in a possible option. I do not know what were the options. It was A, B, D, or A, B, or A and D only. So this is also a possible correct answer in this. Okay, next question, which is the wrong match? So these are surgeries for prolapse, okay, and it was asked which is the wrong match. So for prolapse, we do a vaginal hysterectomy, that's correct. For wall prolapse, we do sacrospinous suspension. We also do sacrocolpopexis. Rectocele repair is posterior colporrhaphy and cystocele repair is anterior colporrhaphy. Colposuspension is done for stress urinary incontinence, Burge colposuspension. So cystocele is anterior colporrhaphy. There's a question on what is a clue cell. This is very, very quite simple. Okay, what are clue cells? They're seen in bacterial vaginosis. And what are they? They are basically vaginal epithelial cells lined by bacteria. It gives a stippling appearance. And that is what the clue cell is. Most common cause of menorrhagia in puberty. What would this be? This would be anovulation. So puberty menorrhagia, that is anovular bleeding, is the most common cause of anovulation. Okay. Then there's a question on least perinatal transmission. Okay, so least perinatal transmission would be, so we know CMV has the highest risk. Rubella also has a very high risk. Hepatitis B also has almost 80%. Now, herpes simplex has a very high intrapartum transmission, not an antepartum transmission. Isliye I'm thinking maybe the question was antenatal. Okay, because HSV has, especially primary HSV with lesions, has a high intranatal, but antepartum, the risk of transmission is hardly 2 to 3%. So if we go with that, HSV should be the correct answer. Okay, which does not cause non-immune hydrops? This was a question. So non-immune hydrops, remember RH, whenever the maternal antibodies are destroying fetal antibodies, that would cause immune hydrops, okay? Not non-immune hydrops. Non-immune hydrops is caused by viruses, by congenital anomalies, by heart disease, by thalassemia. I think thalassemia is also an option. Okay. Then there's a question on endometriosis, patient with classical features of endometriosis. Okay, so you're basically supposed to identify what this is: retroverted uterus with dysmenorrhea, with dyspareunia, with tenderness. This is all features of endometriosis. Now, I don't know what was asked next. Was it the next best step or what is the best investigation? If it was asked best investigation, it would be diagnostic laparoscopy. But if it was asked the next step in investigation, which is what I found, then it would be an ultrasound. Okay. So it basically depends on what was asked. The best test would be a laparoscopy. That's the confirmatory for endometriosis. But if it was asked the next step, you can do an ultrasound, look for endometriotic cysts, which could be seen on the ultrasound. Our next question was women with painless ulcers on the vulva. multiple sexual partners with a history of stillbirth. So when you have this history of stillbirth, always think of congenital syphilis. Okay, so the first investigation you would do with painless ulcers and a history of congenital syphilis would be a VDRL. Okay, then there's a question on male infertility, which is again a very favorite topic asked in the INI, and this was absence of fructose in the seminal fluid. Okay, so questions on, okay, I'm just seeing the comments if I'm missing something. Okay. Okay, best investigation was asked, and it would be laparoscopy for endometriosis. Okay. So absence of fructose is seen both in congenital absence of seminal vesicle and in ejaculatory duct obstruction. So the answer should be both. Okay, then there's a question on Turner or Turner mosaic. Okay, the question was which is not an investigation asked in Turner's. So we do ask for an echocardiogram. We do ask diabetes is common in Turner's. Hearing loss is common. ANA, I think, should be the correct answer here, but I'm not again sure of the question. So if you could help me out in this also. Okay. Okay. Then there's a question on the SRY gene. I think there were two questions on this. The SRY gene is located on the short arm of the Y chromosome. That was one question. And there was another question which I did not get. Okay. And there was a question on pregnancy with fibroid with acute pain plus fever. What should this be? This is again a favorite topic. This is red degeneration. This was also, it was given mild leukocytosis. So classical picture of red degeneration. Okay. Then there was a question, there's another question on non-immune hydrops. There was an image, I think, with a bone marrow being done. There was anemia, a baby with anemia, with aplastic anemia, with cardiac failure. And the possible cause would have been parvovirus. So fetal infections, again, a high yield area, something you can't miss. So the areas from which the questions asked are always the same: primary amenorrhea, male infertility, fetal infections. These are areas you can't afford to miss. Okay, then there's a question on PCOS. Again, PCOS is a favorite of the examiners. It was a obese lady who was infertile and who has hirsutism. And the best treatment option was asked for her. I don't have the options. One option I have is metformin plus weight loss plus clomiphene. Clomiphene was given, letrozole was not given. Clomiphene and letrozole both are first line drugs. Letrozole is a drug of choice, but clomiphene was given. So I think this would have been the best option. If there was a better option than this, let me know. Finasteride was given, but with finasteride, ovulation induction was not given. So that's why I didn't put that option here. Okay. Okay. Then HRT, hormone replacement therapy, causes what? Does it decrease the risk of breast cancer? No, it increases the risk. Does it decrease the risk of endometrial cancer? It doesn't decrease the risk, but estrogen containing, only estrogen containing HRT increases the risk. Okay, so this is also out. Increased risk of vertebral fracture? No, it decreases the risk of vertebral fracture. It's used in osteoporosis. Treatment decreases the risk of colon cancer is right. HRT will reduce the risk of colon cancer. And there was a question on banana sign. I think this is covered in radiology. This is spina bifida. And these are the questions I have, 18 questions. So again, usually we expect around 20 questions from option 20 to 25. Maybe I've missed some out. Please help me with that. And yeah. Okay, so finasteride was there, but urinary gonadotropins, no. You would give in this woman clomiphene. If she was desperately wanting conception, clomiphene would be the way to go. Sir, I think gynae is done.
Thank you very much, ma'am. And I think once we come out with a proper video with all the options, it's going to be more delightful to watch.
Yeah, yeah.
And now we have, again, I have so many of my favorites in Cerebellum. I can't keep this word favorite as a copyright to one of the teachers, but now we have somebody who's very organized and all the programs of the country come under his preview. So we have the Dr. Vivek Jain, sir. And over to you, sir, for the questions of PSM for INICET May 2023.
Thank you so much, Dr. Pulmera, sir. Thank you so much, Dr. Rana, ma'am. It was a lovely session, friends. Today, PSM may not be favorite of the students because what I've come to know that paper was in fact quite difficult. Friends, what happens in PSM every time is they give around 18 to 20 questions, out of which 14, 15 are easy, 4 to 5 are difficult. But this time, I have got around 18 questions till now, out of which 10 were easy, but 8 were very, very difficult. So these things happen. Let me share my screen. Students are not ready today to even recall the PSM questions. So I am just having, friends, the questions as far as I know. Please help me complete the choices. It will help us in releasing a good video on the discussion. Okay, Dr. Shivam, I know it was tough, but let us look at the question. There was one question related to immunodeficiency disorder. Dr. Hashandra says there were 20 plus questions. Yes, PSM has been allotted 20 questions actually in INICET exam. Vaccination in immunodeficiency disorder. What were the choices? Friends, I don't know, but let me tell you, vaccines, inactivated vaccines are safe. We have discussed a lot of times that live vaccines usually should not be given. Most of the students are saying unable to recall. It's okay, friends. This happens with everyone. It's okay. Difficult questions we don't recall. Easy questions we mark with so confidence we forget. It's a normal thing. Don't worry at all. So let me tell you, whatever as far as I know, vaccination in immunodeficiency disorder, you cannot give live vaccines because the attenuated virus or bacterium may feel like a complete virus or potent bacterium. So it is better to give inactivated vaccines. So depending on the choices you can give, right? If names of syndromes were mentioned, then please remember Wiskott-Eldridge syndrome, you can give killed vaccines. That is quite easy to ask. But depends what kind of choices were given. If contraindications were asked, you have to see which syndromes were mentioned as immunodeficient. There you cannot give live vaccines. This you have to remember. Then this was a repeat question, right? What students have shared with me that there was an image of trombiculid mite, right? Orientia, Rickettsia, Susuga Mishi. Just please confirm this image was there. This must have been one of the easy questions of the exam. And medical entomology, environment topic we have covered. Okay, for the previous question, students are saying name of syndromes were mentioned. Friends, immunodeficiency syndromes, you can rule out. There you cannot give live vaccines. But any other syndrome where there was no immunodeficiency, definitely vaccines can be safely given. Okay, so this was there exactly same image. Thankfully, good. First time some students have replied in positive for PSM today. Okay, I'm happy, friends. Aaj to din ban gaya, right? Okay, so this is all of us know, right? Scrub typhus, Rickettsia, Susuga Mushi. Let's move forward. There was one question related to matching of the pneumoconiosis along with the associated clinical disorders. I'm sure you must have attempted this correctly. Asbestosis, all of us know, mesothelioma. Asbestosis also we know with lung cancer. Coal exposure, Kaplan syndrome. Kaplan syndrome, second most common is silica dust also. But I think you can help me complete these choices if you remember, friends. I'm sure you must have matched correctly because the trick about solving the match the following questions is generally out of the 4 choices, if you know 2 correctly, you are able to match them based on the permutation combinations given in the choices. So I'm sure you must have attempted this question correctly. Okay, students are saying there is one question on DPT vaccine also. Please share in the comment box if you remember the question on DPT vaccine that I have not included. Okay. Then there was a question on kappa statistic calculation. Friends, this was one of the difficult questions, really difficult question because it requires actually 5 to 6 minutes for understanding what is kappa statistic is. It is actually a level of agreement between 2 different observers. So if you were given 2 different sets of data, in both you will have to calculate the kappa agreement between both the investigators. Like suppose one table of screening test is given, second table of screening test is given. In both you will have to see that both the investigators agreed true positive in how many, both the investigators replied no or true negative in how many. That will be your observed agreement. Then you have to calculate expected agreement also by looking at their individual results. And then the formula, observed minus expected divided by 1 minus expected. I know it is slightly difficult, but what I'll do is once I get the complete question, I will definitely try to make a small video on this and release. Okay, question I've got from Dr. Happy is that child got fever with DPT at 6 weeks. At 10 weeks, what should be done? See, generally we give DPT. Delay is not suggested. If the mother or the mother feels child is actually having high fever, she won't even turn up at the health center. So mild fever, we manage side by side and continue with the immunization schedule. Okay, 2x2 table was given. Okay, from 2x2 table, Dr. Hensey John, what I will suggest is true positive and true negative is used. If you add both of them, that will give you observed agreement. And then you individually see that how much investigator A or B, what they have done, and you can calculate expected agreement and then formula observed minus expected divided by 1 minus expected. Okay. DPT dose. Okay, what was the question? I'm getting different questions. Okay, friends, let's move forward then. Okay, then there was a question on Kaplan-Meier curve. Question was band, which is used for confidence interval. This was, friends, a difficult question, a new question, I must say. We use Hall-Wellner bands. If it was given in the choices, this is the best answer. We can use other bands also, but if this was given, then this is definitely the best possible answer. Hall-Wellner bands are used for calculation of confidence intervals in Kaplan-Meier curve, which is used in survival analysis. Frankly, this was one of the most difficult questions. I'm sure even PG students cannot attempt all the questions that was there in the exam today. Really surprising, but this happens, right? Some subject will come easy, some will come difficult, right? Okay. Then there was a question on antibiotic in dog bite. Friends, as we always say, dog bite. Even if the dog is vaccinated, it will not make any difference according to the current guidelines of Rabies Prophylaxis Program 2019. Even if dog is vaccinated, ignore that and immunize the person properly according to the category of bite. This is one thing. Second is local wound management should be done with running soap and water for minimum 15 minutes. Now guidelines say even antiseptic you can apply on the local side. Suturing should not be done. If it has to be done under local serum cover, it should be done. Immunoglobulin requirement if category 3 bite. And regarding antibiotic, what we say that you should give a broad spectrum antibiotic. Usually amoxicillin clavulanic acid combination is considered best. Augmentin, one of the most popular brand names, ENT, it is used a lot. That is used. And of course, tetanus toxoid should also be given. Right. Then bioterrorism, all are true except about categories. There was one question related to this, friends. You know, bioterrorism, there are 3 categories ABC. A is most dangerous, most easy to spread. Tularemia, is there in that. Anthrax is there, smallpox is there, plague is there, viral hemorrhagic fever is there, botulism is there. Then there is category B, slightly less dangerous, slightly less easy to spread. So this includes your brucellosis, melioidosis, water threat, food safety threats, all these. And then there is category C, new emerging pathogens, Nipah virus, hantavirus. So I'm sure you must have marked this answer correctly. If there was any mention of category D, there is no category D in bioterrorism agent as of now. If there was any mention of COVID, COVID is not a bioterrorism agent, right? So category A, B, and C are currently used in bioterrorism. Okay, let's move forward. Then there was one question on standard deviation. This question students told was one of the easiest questions of the paper, so no one was able to recall this initially. Most dangerous is category A. Bioterrorism, most dangerous is category A. Okay, friends, then normal distribution, 1 standard deviation, mean plus minus 1 standard deviation covers 68% of the values, precisely 68.3% of the values. I am sure you must have attempted this question with your eyes closed also. So nothing to worry on this. Okay, there was one question on incubation period. Dr. Soumya has mentioned. Do let me know in case you remember the language of the question correctly. Otherwise, I'll leave my number at the end. You can WhatsApp me also, friends. Okay, then. Okay, standard deviation formula was given. Okay, friends, this was also there. Formula of standard deviation, we know. Root means square deviation. I cannot write it here, but I can tell you. Root means square deviation. So deviation, you know, x minus x bar, bracket close, square it. Then sigma divided by n. And then under the root. I'm sure you must have seen this. First, you square the deviation. Deviation, you know, x minus x bar, square it. This is the squaring. Then summation divided by n. At few places you use n-1 also. This will give you the mean square deviation, and then you take the under root. Root mean square deviation, right? Okay. Then there is a new question on chart to evaluate normalcy of data. Now, friends, normalcy of data, you generally use 4 types of charts. I don't know which choices were given. We use histogram, QQ probability plot, Shapiro-Wilk test. I think Shapiro-Wilk test and histogram were mentioned in the choice, and Kolmogorov-Smirnov test. So 4 are used. If they ask you a single answer, out of them best, you tell me. If you look at any graph and you have to look at normal distribution, out of these, you know about histogram. Histogram actually is the best test to represent, best graph to represent, statistical chart to represent normal distribution of data. So friends, histogram is best. Otherwise, QQ plot, Shapiro-Wilk and Kolmogorov-Smirnov test also we can use. Okay, then, okay, Dr. Shivam has shared, there was a question on incubation period matching. Okay, friends, this is easy. I'm sure all of us know. I don't know the choices, but choices what you have told me. Hepatitis A is 15 to 45 days. Hepatitis B, 45 to 180 days. You are saying syphilis, 9 to 90 days. All of us know, right? Okay. Wonderful. All of you have attempted this correctly. Okay, see, reading the question correctly is also important, whether they ask the correct one or they asked all of the following incubation period matched are correct except. So this has to be kept in mind. So friends, questions have already crossed 22. So I feel if there were 22 questions, 12 to 13 appear to be simple, but 8 to 10 were quite tricky. Okay, let us move forward. So I'll repeat again, normalcy of data, histogram is the best diagram. Then there was some question on mean median mode. Students told me that there was some description given, right? So friends, please, if you know about or if you remember about mean median mode, what was mentioned, I'm sure you must have answered correctly. Mean is the average, statistical average, total sum divided by number of observation. Median is the middle value in ascending order. If number of values are even, take the average of 2 middle values, and mode is the most frequently occurring value in data distribution. If there is skewed data or outliers, then median becomes better than mean. Otherwise, overall, mean is the best measure of central tendency. Mean is the best measure of central tendency in metric data, median in ordinal data, and mode in nominal data, right? Okay, friends, let's move forward. I'm getting few more questions in the comment box. I'll go through them and prepare more. Okay, there was one question overlapping with biochemistry. Higher thermic effect, highest, rather it should be highest thermic effect is seen with proteins, carbohydrates, or fat. You tell me, friends. Proteins, carbohydrate, or fat, which is the most important nutrient for our body? First importance, protein. Pro means first, teen means importance. So therefore, in balanced diet also, we first try to balance the protein component. So highest thermic effect is also with protein, that is around 20 to 30%, as compared to carbohydrate 5 to 10% only, and fat is only 0 to 3%. This we should remember. Okay. Then there was one question on nested case control study. Students are not able to give me choices. I can tell you nested case control study is just like stem cell banking used for. This we have discussed in ample detail in all my videos. Nested case control study question must be the easy one. It is done for new rare diseases with unknown exposure, and it is done or used when diagnostic tests are very, very expensive. It is a combination of a big cohort study and a small case control study. Single answer, it is mainly a cohort study because it is temporal in nature. This should be kept in mind. Then there was one question on category of diseases, but these students were not able to tell me. Okay, from the previous question, Dr. Sushma is saying mean is affected by extreme values. Yes, median is generally not affected by extreme values. This was a repeat question. Okay, some students are saying retrospective cohort study. Students, you have to tell me the exact question. Was study design mentioned? I can tell you quickly. What is retrospective study design? You go in the past, take the exposure from the hospital records, come to the current time and see how many of them have developed the disease. It is a cohort study. You can calculate definitely RR, AR, nested case control study. You take history, blood sample, store it, and go forward. when a new rare disease develops, then you come back to the time when you started the study, and then you compare the cases and controls. So it is a forward and backward cohort and case control combination, mainly a type of cohort study, right? Okay, friends, there was a question on FDA high fat meal. High fat meal, I don't know the choices which were given, but I can tell you that it has total calories 800 to 1000 kilocalories. Proteins give you 150 kilocalories. Carbohydrates give you 250. Fat give you 500 to 600 kilocalories. And fat should contribute more than 50% of the calories in high fat. I'm sure choices must be based on this. Yes, Dr. Phoenix Kalas told us. Yes, you are right. Fat should be more than 50%. Fat calories should be 500 to 600. Carbohydrates 250. Proteins 150. And total calories should be 800 to 1000 kilocalories. Then care protocol. Friends, care protocol actually is used for, it is an abbreviation. Let me break it into two parts. Care. It is case report. It is an abbreviation for case report. If case report was not given in the choice, then second best answer will become case control study. But the single best answer is case report. It was a new question altogether. Okay, Dr. Gokul Suresh has shared the question of nested case control. He says that there was a large cohort and then you select those who are positive and selected some from the remaining. Is this nested case control? Absolutely correct, friends. Example I've given in the video in the Cerebellum app also is also same. 10,000 large cohort worth you have taken, follow for 20 years, 50 new cases occur. Then from the remaining 9950 healthy, you select the number of controls and then do a small case control study. Yes, so this appears definitely to be a nested case control study as the language has been given by Dr. Gokul. Thank you so much, Dr. Gokul. Okay, Dr. Vasanta also says same, that 30,000 people followed for 10 years. So you are following such a big cohort, then you are doing a study on small number of people. This is definitely a nested case control study. Dr. Sakru Singh has also confirmed that. Okay, friends, was there some question on perinatal period stillbirth? Do let me know. Dr. Pur sir is looking at me, sir. This is the last question I've got, but I've seen that students are still having more questions. So friends, what I will do is I'll write my mobile number here or on the Cerebellum or Dr. Zainab's BTR group also you can share, not an issue. Anywhere, just share the questions as much as you can remember. It will help us make a good quality informative video for the upcoming exam. Right, friends? Okay, so thank you so much, because the session I don't want to prolong due to me. And Dr. Pur Mehra sir and everyone, thank you so much.
Thank you, Vivek sir. And now we have a man who has been featuring in a lot of advertisements of lately. He represents the doctors into the modeling world, and he is a natural singer also. I hope he can sing the song, and while singing he can teach us pediatrics and help us crack some questions. Over to a man who is full of energy, Dr. Anand Bhatia with his pediatrics by Dr. Anand.
Thank you, sir. Thank you so much, sir. Good evening to all the wonderful faculties and friends. And thank you so much, Dr. Pur, sir, for this wonderful introduction. So hello, everyone. Welcome to Pediatrics Recall INICET 2023 questions. I'll be to the point. I will not elongate. I will tell you the question and the answer and we'll move on further. Question number 1, which of the following have no or low risk of perinatal transmission? The options are parvovirus, rubella, herpes simplex, and CMV. So as we all know in the TORS profile, that rubella basically it is very, kind of very bad in the first semester. There are maximum chances basically of rubella infection in the first semester. So the following which have a very low or no risk of perinatal transmission definitely will be a rubella, because rubella is very severe in the first semester. Banana sign is a common question for radiology, for many other subjects also. Banana sign, as we all know, it is seen in spina bifida banana sign. If the mother has not taken folic acid during pregnancy, the baby can have spina bifida. And banana sign and lemon sign, two signs are there, banana sign and lemon sign. They are seen in various neural tube defects. So spina bifida is the best answer. Next Next question, enzyme deficient in Pompe disease. Enzyme deficient in Pompe, as we all know, it is nothing but alpha-1 for glucosidase. See, glucose 6-phosphatase, the enzyme deficiency is in von Jerk. Muscle phosphorylase deficiency is in McArdle. Phosphofructokinase deficiency is in Tourette disease, whereas the answer for this question for Pompe will be alpha-1 for glucosidase. Next question, very simple, beautiful question. At 6 weeks of life, at 6 weeks of life, child developed fever after DPT vaccination. Now the child is 10 weeks due for vaccination. What should be done next? I'll repeat again. A 6-week-old baby was there. He had come for DPT vaccination. Now the baby is 10 weeks old. What will you do? So very, very important. The best answer for this question will be exactly, we can give DPT vaccination. Okay, someone said there was no fever. Okay, fine, no problem. Yeah, inconsolable cry was there. Okay, wonderful. That's right, inconsolable cry. So yes, as we all know, that DPT vaccine causes inconsolable cry. This is another separate question. Which vaccine causes incessant or inconsolable cry? DPT vaccine causes inconsolable cry. But if a child had an inconsolable cry for DPT vaccination and coming back to me in the follow-up, can I give DPT vaccination? Yes, of course, you can give DPT vaccination. If the question was a baby had seizures after the DPT vaccination and now he has come for the next follow-up vaccination, then definitely DPT vaccine will not be given, because P for pertussis. Pertussis is very notorious as far as seizures are concerned. But this baby had an inconsolable cry, came for a follow-up vaccination. Do you want to give DPT vaccination? Hanji, DPT vaccination chalega. We can give DPT vaccination. Next question, fever for 6 days. Fever for 6 days with strawberry tongue, conjunctival congestion and peeling of skin. Randomly, this question was fever for 6 days with strawberry tongue. One of my juniors, she told this Dr. Divya from Vijayawada, she said ki aisa kuch picture aaya, something like this came, and she told there were multiple pictures. There were multiple pictures of the strawberry tongue. There were pictures of the conjunctival congestion. There were also pictures of peeling of skin. So conjunctival congestion, peeling of skin, strawberry tongue. As we all know, the baby is suffering from Kawasaki disease, which is a medium vessel vasculitis. And in the acute phase of Kawasaki, in the acute treatment, acute phase of Kawasaki, IVIG 1 to 2 gram per kg per day and a high dose aspirin actually is the best answer for the acute phase of Kawasaki. Again, these are like last 3-year question paper. If you guys have done, there are multiple questions repeated again and again. Okay, I'll repeat again. This classical picture of strawberry tongue and conjunctival congestion and peeling of skin is Kawasaki. Kawasaki is a medium vessel vasculitis, and the treatment of choice for the acute phase of Kawasaki is IVIG. In the convalescent phase, in the long-term therapy phase, you can give a low dose aspirin, but in the acute phase, IVIG would be the treatment. Okay, great. Dr. Zana ma'am, thank you so much. That's wonderful. Causes of non-immune hydrops fetalis are all except. Like this only, in this only INICET, like last 2 years back also, this also same question had come. I'll repeat again, and this is a question we need to pay attention for 1 minute. Causes of non-immune hydrops fetalis are all except. What is this immune hydrops fetalis and non-immune hydrops fetalis? So this RH incompatibility, ABO incompatibility, they are basically the causes for immune hydrops fetalis. I'll repeat again, RH and ABO incompatibility, basically they are the causes for immune hydrops fetalis. Whereas non-immune hydrops fetalis will be having all the other infectious disease like thalassemias, like chromosomal abnormalities, like parvovirus B infection, like congestive cardiac failure. So B, C, D, they all are, very importantly, they all are the causes of non-immune hydrops fetalis, whereas ABO incompatibility and RH incompatibility are the examples of immune hydrops fetalis. Same only, like this only question was there 2 years back, same this only, which is not the cause of non-immune hydrops fetalis. So as we all know, RH incompatibility and ABO incompatibility will cause immune hydrops fetalis, whereas all the infections, rubella infections, thalassemias, chromosomal abnormalities will definitely cause the other one. Okay. Next question. Slap cheek appearance, very wonderful question. Again, one of my junior, Dr. Dhiranjan from Ranchi, he told me a slap cheek appearance question was there. Slap cheek appearance, as we all know, it is also known as fifth disease. And one very, very important thing, it is caused by what? It is caused by parvovirus B19. We have fifth disease and sixth disease, all the FMG, NEET, INICET, these questions, itni zyada baar repeat hote hain, bahut zyada baar. So slap cheek appearance is also known as fifth disease. And in fifth disease, nothing but erythema infectiosum, which is caused by the human parvovirus B19. whereas sixth disease was roseola infantum, which came last year, which is basically caused by human herpes virus, sixth strain, more than 7. And this one is fifth disease, nothing but slab cheek appearance. Which membrane channel is affected in cystic fibrosis? Mother, while kissing her child, found her child's skin salty tasting. There were sodium chloride channel issues. So sodium chloride channel is the one of the membrane which is affected in cystic fibrosis. Some junior had told sodium alag likha hua tha, chloride alag likha hua tha, potassium alag likha hua tha. Yes. So in general, as we all know, sodium chloride channel basically are the main one which is affected in a case of cystic fibrosis. Next question, one student had told me there was a question on the match of the following. Question of the match of the following. They were saying like these 3-4 options were there. One thing was when glutamate is replaced by valine, that happens in a case of sickle cell anemia. Trisomy 21 we see in a case of Down syndrome. Trisomy 18 we see in a case of Edwards syndrome, whereas trisomy 13 we see in a case of Patau syndrome. So these are the recall questions. My juniors told aisa karke aaya tha, so that's why we are discussing like this. So glutamate is definitely replaced by valine in a case of sickle cell anemia. One question was there on incubation period. When Dr. Karan Vikram Singh, one of my very good junior from Delhi, he told me chickenpox, syphilis, and hepatitis A incubation periods were come, and they were like match of the following. So multiple topics in one, like that. So as we all know, measles incubation period is 8 to 12 days. Mumps is 2 to 4 weeks. Chickenpox is 10 to 21 days. Syphilis is 9 to 90 days, and hepatitis A is up to 50 days. So this was kind of the match of the following which had come. So it's like a okay question, good question, which you should remember. Same like this only, iron deficiency anemia, they had given multiple options like that, and they had written A plus B is correct, A plus B plus C is correct. Now so we can't go in the length of the proper question, but this was the recall which happened. So as we all know, in a case of iron deficiency anemia, there is low serum iron, low serum ferritin, low transferrin saturation, and a very high total iron binding capacity. So this is what happens in a case of iron deficiency anemia. Okay, I hope you got it. One more question had come regarding the Rett syndrome. This was the Rett syndrome. It is not there in OPGAI, it is there in Nelson. Newly approved drug. This one question was there. At least the drug you should know, this torphinitide. So that is the drug basically we use in the Rett syndrome. A girl having a hand wringing movement, one of the important causes of acquired microcephaly, Rett syndrome. Bas ye drug ka naam yaad rakhega. Please remember this name of the drug. That is torphinitide. One spotter was there on this. As we all know, this is a ranula. Okay, it's just an image based question. There's nothing but ranula. This is one question had come. One question had come on the meconium stained baby. One question had come on the meconium stained baby. The detail of the question we don't know, but there were some pointers I remember of the meconium stain. Number one, there was a question she was asking, like meconium stained baby, as we all know, do you suction the trachea? Yes or no? The answer is no. Suction the trachea will never be the right option. One of my junior told suction the trachea was one option. So we never suction the trachea. One or more option was there, intrapartum suctioning. The mother has been taken up for delivery, and intrapartum only there only, during the labor itself, we're gonna intrapartum suction baby's mouth and nose. Intrapartum suction I have never done. We don't do intrapartum suction. If you just want to suction, once the baby is out, there are only two things, whether the baby is a vigorous meconium stained baby or a non-vigorous meconium stained baby. What is non-vigorous? Non-vigorous is heart rate less than 100. Heart rate less than 100 is non-vigorous. Heart rate more than 100 is vigorous meconium stained baby. In a case of non-vigorous meconium stained baby, you will do the bag and mask ventilation after the suction of the mouth and nose. I'll repeat again. This is the last question. In a case of meconium stained baby, do you suction the trachea? No, we don't suction the trachea. Do you want to do intrapartum suction? Do you want to start? No, we don't do that. Then what do? We have to see whether the baby is vigorous or non-vigorous. What is non-vigorous? Heart rate less than 100. Heart rate less than 100, we all know bag and mask we do, but after suction the mouth and nose, we do the bag and mask. And what about vigorous meconium stained baby? Vigorous meconium stained baby, you don't do the bag and mask. You only suction the mouth followed by the nose. That's it. That finishes this class. Thank you so much, everyone. And before leaving, we all know that, just do your best and destiny will do the rest. Jo ho gaya, wo ho gaya. A positive socho, definitely positive hoga. Thank you so much. I finish my session. Dr. Apur sir, over to you.
Thank you for the energy, Dr. Anand. I wish we were all like you. And
Yes.
I think there would not be anybody less worthy than the next person in line. She is absolutely another lady filled up of energy and knowledge. And again, I told you, if I have to use this word favorite, it will be copyrighted. It can't be. Here, all my favorites are on one screen as I see all the teachers of Cerebellum. So Dr. Priyanka, with the questions of micro, Keep the pace on, Priyanka. The students are loving the session. Over to you. Thank you.
Good evening, sir. Good evening, everyone. Good evening, all faculties, all students. Thank you so much, sir, for the generous introduction. Thank you so much. I hope I'm clearly visible. Let me share my screen. Just a second. So the discussion will be crisp, up to the point. This is the initial recall. So let me start. So there was one question on hepatitis, I guess. Hepatitis graph was asked. So I guess you may be knowing the sequence. If you know the sequence, whatever was missing in the graph, you can point out that. You may be knowing that there are two antigens which come in the blood, hepatitis S antigen and E antigen, followed by the antibody. C never come in the blood. The antigen C never come in the blood, but the two antibodies of the C come in the blood. So first antibody comes of C, that is IgM, followed by E, followed by again C, but this time it's IgG, followed by S. Okay, so this is the sequence you can see. So from that, you have to help me what was missing. What was the missing? So what was the missing? You and G never go to the baseline. You can see here G never go to the baseline. Once it come, it will be always there in the blood. It is showing the past. So whatever is missing, I guess, yes. So anti-HBC was asked. Anti-HBC was asked. If you know the sequence, you can make it out in this graph. So that was the first question. I mean, I'm discussing it first question. It is hepatitis B graph. Okay, so you know that. Now the next question was on zonal phenomenon. So I guess you may be given the titers in the test tube. So there are three zones we find whenever we mix antigen with the antibody. The antigen antibody should be in appropriate the proper proportion. You know, they should not be equal. The antigen is also multivalent, the antibody is also bivalent. Most of the antibodies are bivalent. So whenever they combine with each other now, so the lattice is formed only if the antigen and antibody both are equivalent. You can see here, you can see the lattice is forming here, right? So lattice form only whenever there is antigen antibody both are in zone of equivalence. But whenever the antigen is in axis, it is known as post zone. And whenever antibody is in axis, it is pro zone. So you have to help me. What was given in the question? Was it antibody axis or what was antigen axis? In the title, can you understand? Can you help me? So yes, axis antigen. And there is a very easy way to learn that. I am saying antigen axis and antibody. In ABCD, B first come now. So that's why it's pro zone. And G comes later on. That's why it is known as post zone. This is a way I tell the trick always how to learn that. So of course, the answer is the pro zone because in the question, antibody axis was asked, right? So this question, yes, the dilution was given and the titers were given, right? So in the titers, you can make it out. It was antibody axis. The answer was pro zone. It was an easy question. I guess this question discussed multiple times. Dr. Anand also discussed this question, right? The slap-chipped appearance. The slap-chip appearance, it was in children. It was parvovirus and it is associated with pure red cell aplasia. So discussion was straightforward, one-liner, no confusion. I guess the parvovirus question is discussed multiple times. Now the next question was on a gram-positive bacilli. The first thing you should know from the gram-positive bacilli, how many were there in the option? There are 6 gram-positive bacilli, right? So the mnemonic is A, B, C, D, L, M. From these, which were present in the option, you have to make it out, right? And damn sure in the option, you may be having 2. Like among the actinomyces, there are 2 actinomyces, the nocardia and actinomycetes. The nocardia and actinomycetes both come under the genera actinomyces. You know, both of them are filamentous. Both of them are gram-positive. I guess in the question, you may be having either acid-fast word or aerobic anaerobic. That will change the question. Yes, the branching, the filamentous, one and the same thing. You know, so I'm saying the branching and the filamentous, the branching, whether you say branching, whether you say filamentous, right? And gram-positive bacilli. These all things are applicable to both the nocardia also and actinomycetes also. But you have to see what was there in the question. Nocardia is a strict aerobe. It is a strict aerobe, hai na? And actinomycetes is a anaerobe, right? The first thing. Nocardia is acid-fast. It is acid-fast, and actinomycetes is non-acid-fast. It is non-acid-fast. So you have to pick, you have to help me. I guess few students were saying they got in the question the word acid-fast. If you got the word acid-fast, sure, the question answer is going to be nocardia, right? So what was there? What was there in the question? Can you please help me? What was there in the question? Acid-fast was not mentioned. Okay. So was it aerobic, anaerobic mentioned? Or in the option, you get both of them or you got only nocardia in the option. If the other option was, one of the option is not actinomycetes, there is no confusion in that. But if you have both in the option, some students were saying they got both in the option. If you got both in the option, there should be some clue to differentiate them. There are only 2 differences, acid-fast and aerobic. So yes, okay. If it was acid-fast, answer is nocardia. If it is not acid-fast, answer is actinomycetes. Okay. Okay, actinomycetes was not in the option. That's very good. Very good. It was not there. And there is no confusion in that. So answer is going to be nocardia, straightforward. Now you get many questions on the fungus. Many students told me that they got questions in the fungus today, so on the images of the fungus. So you got 2 images today, I guess. One is of aspergillus and one is of mucormycosis, right? That is zygomycetes, right? So you may be able to differentiate them. Yes. So aspergillosis, can you see the septa? See the septa, see the angle. It's an acute angle. It's less than 90 degrees. So always acute angle branching is there. And see the hyphae. The hyphae is branching. If you can zoom, you can see it's branching. The hyphae is showing branching. And if you can see, it's narrow. The hyphae is very narrow. See the width. It's a narrow hyphae. So here the answer is aspergillus. Was it a spotter? Was it an image-based question on the aspergillus? Or you got a clinical scenario along with the image? So yes, invasive aspergillosis. Yes. Was it a clinical scenario-based question along with the image, or it was a spotter image like IBQ? You have to help me. I guess you got the image, right? Based on the acute angle branching and septate hyphae, you have to come on the conclusion it is aspergillosis, right? The next is the mucormycosis. Was it also image-based question? Only one difference is there. What is the difference here? Here the hyphae is non-septate. You can see the hyphae is there. The branching is there, but it is not non-septate. Aseptate hyphae, and you can see it is relatively broad as compared to aspergillus. And here the angle is also wide. If you can see the branching angle, it's wide, it's not narrow. Yes, yes. So clinical, you got a history on them, but the spotter is the image. And in the image, you have to notice 2 things. Number 1, you have to see the angle, it's narrow or it's broad. Number 1, narrow angle is aspergillus, the broad angle is mucormycosis. Number 2, the most important, you have to see in the branching, in the hyphae, septa is present or absent. If the septa is present, it's aspergillosis. If septa is absent, is mucormycosis. And I guess, okay, mucormycosis was not there. Was it a clinical question on, there is a question on mucormycosis, but was it a clinical question then? Okay, okay. So the next question, we will discuss the question in detail later on. Let's all the options, all the questions come up, right? So till now, whatever information I got, I'm taking the session on that. But in a day or 2, we will come with the detailed record, don't worry. So the next question was on the dog bite. The patient was of which category? You have to help me. Category 1, simple licks, or category 2, wound is there, but no bleeding is there, or category 3, severe bleeding. So first decide the category. What was the category? Based on that, your answer will differ because. So what was the category mentioned in the question? In the dog bite question, what was the category? It was a cat 1, cat 2, cat 3. You were given directly category, or you were given a description to decide the category. Simple licks were there, or wound or without bleeding, or wound with bleeding. So what was there? So yeah, in the options, you got the antibiotic. Yes, splenectomy, dog bite. Okay, wound injury was there. So bleeding or not bleeding is not mentioned. I guess it may be category 2 then. It's not simple leaking now, and it is not severe oozing of the blood. So take it as category 2, I guess, right? And the person was already immunized. The dog is also immunized and the person is also immunized, right? So if the person is already immunized, does the time of the immunization is mentioned? Like within 3 months or more than that, if it is already immunized? It is a punctured wound, okay? So what were the options? You have to help me with the options. If it is within the 3 months, nothing has to be done, only local care with antibiotic. Antibiotic, you can give antibiotic to prevent the secondary bacterial infection. We are not giving antibiotic to prevent the rabies, So rabies is not prevented by antibiotic, it's a virus. To prevent the secondary bacterial infection, we will give antibiotic, local wound care, and we will do just observation. If the person is already immunized, but if the person is immunized by more than 3 months, then one of the schedule has to be followed. There are 3 schedules, you may be knowing that, then one of the 3 schedules has to be followed. Okay. So the person is immunized, it is mentioned. No, person is not immunized. Okay. Yes. So if the person is immunized, if the dog is also immunized, and it is coming in category 2 or category 3, doesn't matter. The answer will be observation along with antibiotics to prevent the secondary bacterial infection. There is no gold standard treatment like drug of choice for this antibiotic. Any broad spectrum antibiotic can be given. Okay, so you have to help me. Okay, okay. Okay, the question was on, not on rabies schedule, but on the choice of antibiotics. So please enumerate. So it is metronidazole or amoxicillin. Okay. Okay, so this question will be the broad spectrum antibiotic. You have to see the one which is having broadest spectrum. You have to go with that along with the dog bite. Okay, so if the vaccine is not there in the option, there is no question of that. Okay, the next question was on differential motility of the bacteria as mentioned. I mean, it was mentioned the bacteria was motile at 22 or 25 and is non-motile at 37. So only one bacteria do so. The name is Listeria. Was Listeria there in the option? It's a motile bacteria. It is having peritrichous flagella all around the bacteria. You can see the peritrichous flagella. The peritrichous flagella is present all around the bacteria, and it is motile specifically at 25 degree, 22 to 25 degree, and it is non-motile at human body temperature, that is 37. So it is motile outside the human body, not inside. This is known as differential motility. So was Listeria there? Was Listeria there in the option? Kindly let me know. Listeria there in the option? So if Listeria is there in the option, the answer is straightforward Listeria, because no other bacteria show differential motility. So yes, if Listeria is there in the option, you have to go with Listeria, the differential motility question. Can you help me? Yes. So Listeria is the answer. Okay. The next is, you got a question. There is some protozoan parasite inside the Kupffer cell. Now, the clue in the question, what are Kupffer cells? Kupffer cells are present in liver. What are these cells? The Kupffer cells are the macrophages. These are a type of macrophages present inside the liver. You may be knowing that. Now, name the parasite which is present inside the macrophages. Can you name the parasite which is present inside the macrophages? So I guess these were the options. These were the options. Can you verify? These were the options. So you can see this is the macrophage here. Inside the macrophage, this is the nucleus of the macrophage. In the cytoplasm of the macrophage, you can see the amastigote form. This is Leishmania. This diagram is of LD body. So was the question based on the LD body? You were asked a protozoan parasite inside the Kupffer cell. Kupffer cell is a macrophage. Inside the macrophage, Leishmania reside, and it is known as LD body. So answer is going to be Leishmania if it was the question. Was it the exact question I have written? Or some changes there, you can tell me, so I can modify the question accordingly. Okay. So amastigote form of the Leishmania and the macrophage. Yes, and Kupffer cells are a type of macrophage. So the correct answer would be Leishmania in this case. Okay. Now the next question, it was some descriptive case scenario based question in which there was an elderly patient was there, diabetic patient was there, which was on multiple immunosuppressive drugs was there, right? And biopsy showed gram-positive oval bud yeast with pseudo-hyphae. Was this is the exact question you got? Pseudo-hyphae. You didn't got the image. Image I have provided you, right? So you got a question on the pseudo-hyphae. If pseudo-hyphae word was there in the question and the patient was immunosuppressed, so answer has to be candidiasis. Candidiasis is an opportunistic fungus which occurs in immunocompromised state. The patient is already diabetic. The patient is already elderly. So two risk factors are already there for the candida. The third, the biggest risk factor will be the immunocompromised state. And the biggest clue, you got a gram-positive oval budding yeast with pseudo-hyphae. So answer has to be invasive candidiasis for this question. Yes. So answer has to be invasive. So three big risk factor along with the pseudo-hyphae is the biggest clue you got. Now, whatever clinical history you got, you may got some symptoms. Candida can involve any organ of the body technically. It can invasive candidiasis, all the organs. No, I don't know exactly what was the question, but it was some clinical scenario based question with three risk factors given to you. So I guess the answer is yes. The answer is, if it is a transplant patient, the transplant patient are already on immunosuppressive drugs, right? So yes. So the correct answer will be invasive. Now you got question on one of the liver abscess. The options were hydatid cyst, the option was bacterial abscess, the option was Echinococcus granulosus abscess, so and amoebic abscess. So you got the clue that the margins were irregular and the patient had dysentery. I mean, the blood in the stools were present. So what were the options? Can you help me with the options? If the patient have dysentery with irregular margin, and what other clues were given to you? Then most probably, if this is the clues given to you, the answer has to be amoebic abscess, maybe, but you have to give me more clues to come on the correct answer. So I guess the options were, one of the option was bacterial abscess, one was the option was bacterial or pyogenic abscess is one and the same thing. The next was amoebic abscess. The next is the hydatid cyst. What were the more options? Can you help me? Fever was there. Okay. Yes. If the fever is there, the biggest clue given to you, the patient have dysentery. Dysentery means bleeding in the stools and irregular margins. Right. So patient, it has to be amoebic abscess here. No, pyogenic abscess can also be there, but you have to give me more clues. Currently, the answer can be between. And was there some history given what the patient have eaten? What the patient after eating that cyst is there? So you can text me, on the multiple, social media platforms I'm available. You can text me the exact question with the exact options. We will be covering with the detailed recall later on. So currently, these many were the questions I can collect of microbiology. And that's all about it. So, sir, it's up to you. Thank you so much. I will be coming with detailed recall soon. Thank you. Sir, it's all up to you.
Thank you very much. And now I'll request Dr. Srinivas to take over. Sir, you have to unmute. Dr. Srinivas, you have to unmute.
Yeah,
Thank
I hope now I am audible.
Perfect.
Thank you so much, sir. Let us start with the discussion. I will start sharing my screen. I hope my screen is visible. Please.
Visible, sir.
Thank you so much, sir. So let us begin the discussion. Yes. So myself, Dr. Madhiran Srinivas, friends. So there were quite a good number of questions asked in dermatology. So among which this was the question on wood slump finding in this disease. And I have marked all the correct answers for you so that it will not be a time waste process. So in the tinea capitis, we can see blue-green fluorescence on wood slump examination, and in vitiligo, we can see milky white fluorescence, and in pityriasis versicolor, yellow fluorescence can be seen, and in erythrasma, which is produced due to Corynebacterium minutissimum, coral red fluorescence can be seen. So we'll not go into the details of this, but this is tinea capitis, which can show green fluorescence, and this is erythrasma, in which we can see coral red or pink fluorescence, and in vitiligo we can see milky white fluorescence. The next is in the basics. This was a question in which these lines were shown depicted, and you need to identify what is the name of these lines. And I hope all of you.
Your screen is not moving. Dr. Srinivas, your screen is not moving. You have to move, moving.
Okay, sir.
Can you repeat the question again, the previous one? Yeah.
Yes, sir. Yes. So this was the first question. So wood slump finding, these are the options. This was given as a match the following, and these are the right answers. Tinea capitis, blue-green. Vitiligo, we can see milky white fluorescence. Pityriasis versicolor, yellow fluorescence. Erythrasma, we can see coral red fluorescence. I hope, yeah, now the slides are moving. Thank you so much, Apur Marasar, for guiding. And yes, this is the next question in which we can see certain lines were given. And as you can see, I hope this was the exact question which was asked. Please confirm in the comment section if this were the lines. So students told me that the lines were not being having any interruptions in the midline. And also these lines are having a U shape in the face at the central part, and they are having a linear arrangement above and below the lips. So if these were the lines which are given, then the answer is going to be relaxed skin tension lines, which are nothing but Langer lines, which are Langer's lines. And this somewhat looks like this. Who is it? Thanos. So I will not go into the details, but Blaschko's lines was also there in the option. So I would like to tell you how to differentiate Blaschko's lines. If you see Blaschko's lines will have a spiral nature over the scalp, and the Blaschko's lines will be linear over the extremities. So this is how we can differentiate between Blaschko's lines and the Langer's lines. Next is non-scarring alopecia. Non-scarring alopecia is associated with all except. So this was the question which students told me as a recall. I hope this was the exact question. So among the given options, frontal fibrosing alopecia is an example for scarring alopecia. Scarring alopecia, and the rest of the others are all non-scarring alopecia. So in fact, there are so many conditions in which non-scarring alopecia can be seen. You can remember that with the help of this simple trick, all those conditions which are usually starting with alphabet A and T are non-scarring or non-cicatricial varieties of alopecia. As you can see here, alopecia areata, trichotillomania, tinea capitis of non-inflammatory varieties, which are gray patch and black dot type of tinea capitis. And you can see here anagen effluvium, pilogen effluvium, and androgenetic alopecia. Apart from this, there are certain other conditions which you must remember, even thyroid dysfunction, systemic lupus erythematosus, and secondary syphilis. These also are going to produce non-cicatricial or non-scarring alopecia. So now coming to papillosquamous disorder, this was a question which many students have told me that it came. A young male, 24 years of age, complaining of asymptomatic scaly lesions over the body, and the images were given, which were showing this Christmas tree pattern of the small lesions, and cholerated scaling was also shown. So if this was the clinical picture which was given in the MCQ, then the answer is going to be pityriasis rosea. Okay, I hope this was the exact images or at least related to this kind of image like Christmas tree pattern was given. So in the comment section, please do let me know if some other options were given. And this was the next question from vesicular bullous disorders. So clinically, patient is having flaccid bulla with painful erosions on histopathology showing suprabasal split. So this was the statement 1 which was given. Few students told me that it was an assertion reason type of question, and few students told me that this was given as a statement 1 and statement 2 types of a question. And in the statement 2, it was mentioned that row of tombstones appearance is diagnostic of pemphigus vulgaris. Pemphigus vulgaris. So option, the statement 1 and statement 2, both of them are true, but the correct 2 is not going to explain the 1. So if the statement 1 was telling that hemidesmosomes are present in the stratum basal, which will help in connecting the stratum basal cells to the underlying dermis, then that would have been, we can say statement 1 and 2 are correct, and reason is assertion is going to explain the reason, and reason and assertion both are explaining each other. But since it is given that clinically patient with flaccid bulla and painful erosions on histopathology will show suprabasal split. This is absolutely right. This is the thing which we can see in pemphigus vulgaris infant. But these two statements are not related to each other. So I would say this is the answer. So do all of you agree that this was exact statements which are given in the exam, or was there any difference from the actual exam statement? Anything else was given? Please do let me know in the comment section. So since this question is a little bit, students were telling different kinds of options. 2 is a conclusion of 1 given, not about explanations. Okay. Statement 2 is conclusion. Okay. So we can say this is not explaining or this is not conclusive. Okay, both are right, but they are exclusive statements for each other. And this is the next question. 60-year female with eczematous lesions, and there is associated itching and urticarial lesions for present. So elderly female coming with urticarial lesions associated itching. And in the question it was given subepidermal cleft was present, and direct immunofluorescence was showing linear C3 and IgG deposition along the basement membrane zone. So what is the diagnosis? I hope all of you have marked. So this was the DIF finding which was given, and also students told me that biopsy finding was also given, which was showing subepidermal clefting. So if that was the case, the answer is going to be bullous pemphigoid. That was the case, bullous pemphigoid. I hope this was the exact question which came in the exam. Please do like the video if this was a question. And the rest of the options, pemphigus vulgaris, dermatitis herpetiformis, and pemphigus foliaceus, were they, these are exact options, or were there any other options mentioned? Yes, bullous pemphigoid, right. Okay, so next in the viral infection, so these were the options which many students have recalled. Maximum incubation periods were asked, and it was a match the following type of question. So I have kept the answers for all of you. Syphilis, it is 90 days. SARS, it is 10 days. Hepatitis A, it is 50 days. And chickenpox, that is varicella-itis, 21 days or 3 weeks. Okay, slap cheek appearance is associated with the virus. It is associated with, this was the exact question which students told, it is pure red cell aplasia. I hope, and also image was also given, but since slap cheek appearance was already mentioned in the question, so the answer is going to be very simple. And Kawasaki disease, drug of choice when associated with 2D echo showing coronary artery aneurysms. So, and also some students told that the answer was mentioned right after the option, that is intravenous immunoglobulin, as correct answer. Was this mentioned? Was this so funny way of asking in an actual INICET exam? Was it mentioned that correct answer? So please do like in the comment section, or was it mentioned as right correct answer? Next, we'll go to the sexually transmitted diseases. So most of these topics are covered by Dr. Rainaman. So I will just tell you, I think this was not covered, or I don't know, flu cells. Flu cells, these are nothing but the actual epidermal cells, squamous epithelial cells, which are covered by the microorganisms. Okay. This was also given in the one of the questions, fluid cells. So the most exciting phrase to hear in science, the one that heralds new discoveries, is not Eureka, but that's funny. So right now, it might not be like a Eureka moment. It might be, you might be feeling that it's funny what I have done. I have made silly mistakes. Maybe you will get to know your silly mistakes, but do not worry. You are definitely going to do great. So this is not just a ending of something. This is the beginning of something great, which is going to happen. If you are not done well in this exam, do not worry. There are many others coming ahead. Thank you so much.
Thank you, Dr. Srinivas, sir. And yeah, so we'll request you to stop sharing the screen, sir. And now we will request Dr. Pooja ma'am to start with her session on physiology questions in INICET. Thank you very much.
Hello everyone, I
Doctor.
hope I'm audible and visible to you guys, and my screen, yeah, I'm sure move ahead. All right. Anyone, please let me know if the screen is visible. Can I move ahead?
It is very good, Pooja. You are clearly visible. Yeah, fantastic.
Is the screen visible?
Yes, 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 yes. It is visible.
Am I audible, guys?
Yes.
Hello. Yeah.
Audible and visible. Please start, Pooja. Please start. Thank you.
First, I think was given. See, sodium chloride, bicarbonate, and yes, we include the potassium, but not serum potassium. But the intracellular potassium we added, right? And that's how the answer becomes. Then, which amino acid? We know that phenylalanine ultimately is going to form tryptophan, and this the tryptophan is useful in the catecholamines. Tyrosine are also helpful in the catecholamines as well as the thyroglazine working through the JAK-STAT pathway. Now, even if you don't know which one is the JAK-STAT pathway, or we haven't discussed, you can always go through the exclusion criteria. You know, these two are via the GPCR proteins, right, via secondary messenger, and this, if these are out, the one left, which is the leptin, and leptin is going to act through the JAK-STAT pathway. Next comes the bitter test. Bitter test, which one of the following stimulates the bitter test? Now understand that the aldehyde, they are usually taste sweet. Okay, amino acid also taste sweet or umami. Hydrogen ions, they give sour kind of taste. Okay, sweet and umami, right? So that's why the remaining one is alkaloid, and most of the alkaloids, they taste bitter. So the answer over here will become bitter. Now there was carbon monoxide poisoning, some graphose poisoning, that it is given. Whatever the question, it was regarding the CO poisoning, and we all know that it is anemic hypoxia. And remember that since it is anemic hypoxia, the dissolved oxygen won't be affected, right? And that's why the graph is going to shift towards the left. Then moving on to the cystic fibrosis, we all know, everybody knows that, we learned that from first year, that is, it is the CFTR gene, and which is going to affect the chloride. Chloride is not moving out, so water is also not moving out. So all these mucus are going to be very, very thick mucus. Let's move on to the next one. Over here, they are asked to match the pairs correctly. Now, when we are matching the pairs correctly, understand, yes, the gastrin is secreted from G cell, only they are present in the ileum and that they are not present in the duodenum or jejunum. Usually they are present on the pairs patches, okay? And CCA from the eye cells and secretin all were correct. Now, understand Wind-Kessel effect. The Wind-Kessel effect is going to be given by what thing? They are given by the large vessels, aorta and large vessels, right? And over here, the renal artery is the direct branch, isn't it, of the aorta? So yes, definitely, the renal artery is going to have more elastic fibers as compared to the radial artery. So that's why remember that yes, you guys are totally aware of aorta and carotid that they do have Wind-Kessel, but understand the renal have more elastic fibers, more will be the more relatively the radial artery is going to have negligible effect. So that's why that is the answer. You all know that maximum thermogenic effect is of protein because it is going to increase the metabolic rate very, very high, that is 15 to 30%, right? Answer over here comes. Move on to the next question, that is blood. Initially, after the Valsalva maneuver, what is going to happen? Now, understand which pressure is increasing. Basically, right? So it cannot be the answer, right? Right. So the more common answer over here is the aortic pressure that is going to increase, which is going to have immediate effect as soon as the thorax is going to have the compression effect. And this was the Nature's article. They have given this mean aortic pressure is going to increase. Now, the next question on the sarcomere, two questions were asked. First question was arrange from the periphery towards the center, right? So we all know that the Z lines are at the most peripheral region. Then comes our this I band, right? Then comes the H zone, and then comes the M line. So answer over here, sorry, the A band is asked. Anyways, the A band is also first Z line, right? The minus the zone 2. Want you to arrange that. Okay. The next question, I did not get the exact options, but they were something like this, right? So what were the options? We have to find out the true statement regarding the skeletal muscle, right? Now, extracellular calcium, where it is required, extracellular is required in CICR, that is calcium induced calcium release. Now, understand this happens in the this thing, smooth muscle and cardiac muscle, and not in the skeletal muscle, but the question is regarding skeletal muscle. So this is whatever releases the calcium, it is released either from the ECF or it is going to be released from the sarcoplasmic reticulum. That's true. Voltage gated calcium channels on the sarcolemma has no role. Now understand, they are going to have role which we are talking about, that is DHPR. Unless and until the DHPRs are activated, they cannot open the RYR channels. Okay, so that's why only 1 and 3 they are correct over here. And that's all from my side. Don't settle for the average. Bring your best to the moment. Then whether it fails or succeed, at least you know that you gave your answer. I hope I'm audible.
Thank you, Dr. Pooja.
Thank you, sir.
I'll request your favorite Dr. Smiley Pruthi ma'am to come with her questions of biochemistry for INICET May 2023. And over to you, ma'am. And following you will be Dr. Praneeth taking up ENT. So you can pass the baton to sir. Thank you, ma'am.
Okay, sir. So good evening, students. Let's do biochemistry questions. In short, I have not got many questions, so you need to help me. I will be, okay, I'm here with your YouTube comments. Okay, so let's start biochemistry. Which amino acid not used for synthesis of hormones? This is the first question which I have got. So keep telling me what answer you marked. Good evening, Sakru. So let's discuss. Yes, the xanthoranic acid, B6 deficiency. With that, let's do questions one by one. I'm well aligned with your comments on YouTube in the live chat. Okay, this question was not there according to one student. Okay, you marked glycine. This question was there, thank God. So 2 students have said no question, no such question. 3, 4, no such question. Thiophorase, the YouTube comments are going so fast. Okay, it's difficult to read. Okay, what was the question on thiophorase? Liver can't use which enzyme? Okay. Liver can't use enzyme. Yes, thiophorase is absent in liver. Why? Because liver cannot use ketone body. Okay, the liver can't use ketone body. So this was the answer. Okay, some students are saying this question was there. Which amino acid not used for synthesis of hormones? Answer is glycine, because tyrosine will make thyroid hormone. Phenylalanine makes tyrosine and then thyroid hormone indirectly. Tryptophan will make serotonin and melatonin. Okay. Another question I got on Pompey's disease. You are too fast. I cannot read at this speed. Okay, let's see. So let's come to one question. The one question which I am discussing, please talk about that. So Pompey's disease, enzyme deficiency. Barth syndrome, cardiolipin was also there. So I'm collecting questions with your help. Barth syndrome, there's defect in cardiolipin remodeling in Barth syndrome. Yes, one question on collagen. I'll come to that. Can you, okay, let's take it one by one. Let's start again. So what is this question exactly? Liver can't use enzyme. Okay, liver can't use ketone bodies due to absence of which enzyme? Due to absence of which enzyme? Right. Other option? What were the other options, if you remember? Okay. What was the question on Pompey's disease? Okay, one question was thiolase. One option was thiolase. That is the first enzyme of ketone body synthesis and also in ketone body utilization. Can you tell me the question on Pompey's disease? Only thiolase and thiokinase, you remember. So Pompey's disease, let's, there was a question on Pompey's disease and the enzyme is acid maltase. Okay, the answer will be acid maltase. What was the question on Barth syndrome? There was a question, clinical history given for the child with diabetes and which test positive. So this image was given with purple colored ring. So that must be Rothera's test for ketone bodies. Rothera's test is for ketone bodies, right? Then there was a question on xanthuranic acid. vitamin B6. If you remember exact question, do let me know. Then there was a question that which of the following is not the amino acid in collagen? Okay, Deepak Kumar is saying acid maltase was not in the option for Pompe's disease. Acid maltase was not in the option. Then what was the question? Collagen question was, okay, what was the collagen question? Which of the following is not the amino acid in collagen? Can we stick to one question, students? You are just jumping between questions. Different students, they're answering different questions. I cannot read at this speed. Okay, then next one question was there on DNA sequence, template strand given. There was a question on DNA sequence, the template strand was given. I think there is a lag between the chat and when I'm talking. So that's why we are not able to align. So still the chat is going for collagen and I am here at this question on DNA sequence. ATGC arrange karna tha. Sequence of mRNA asked. Okay, so how did you solve this question? Let me tell you how to solve this question. At least we discuss something. So suppose this was the base sequence of DNA template given. Whenever this is a common question which is frequently asked and it is little tricky to answer. So let me discuss it and check yourself whether you did it this way or not. So if it is GATCTAC, okay, 5' here on 3' here, when the sequence is given, then 5' 3' is not given usually in the question. Okay, so 5' on left hand side and 3' on right hand side, obviously. Okay, whenever sequence not given, we will write it this way. Now, this is DNA template strand. Whenever they have asked RNA, this is a frequently asked question. First, we will make the non-template strand. In non-template strand, everything will be complementary. The direction is opposite. 3' to left hand side, 5' to right hand side. So instead of opposite to G, we have C, T, A, G, A, T, G. Okay. Then whenever you have to do this question, first make non-template strand and then you make RNA, because direction as well as codons of RNA and non-template is same. We just have to replace T with U, CUAGAUG. But now 3' is on left hand side and 5' is towards right hand side, and the options given, again, direction is not given. Direction is not given. So you will bring G here and C here. So GUAGAUC. So here, if this question is there, just go with let's go with the concept. If this question is there, then answer will be D. So you have to follow these steps to make it simplified, and without any mistakes, you will be solving this question. Okay. So whatever the sequence was given in the question, I do not know that what sequence was given. So whatever was given, this way you have to solve. Okay. And I think I need to collect more questions. And this is the common question which was discussed in SPM also, PSM also, and physio also, highest thermic effect. So this is of proteins. First proteins, then carbs, and then fats, This is also called SDA, specific dynamic action. Okay. So I'll give my number so that you can share the questions and I'll send the PDF. I'll prepare the questions and I'll send the PDF. Right now, I have not got enough questions, and the speed with which the YouTube chat is going, I am unable to read. And so one question, bas tika you karna tha, student is saying, right? Okay, so this is my number. Do share the questions, the exact question if you remember, with the options, and please help me in collecting all the recall questions. Thank you. Over to Dr. Who's next faculty? Dr. Praneeth. Dr. Praneeth, over to you.
Yeah, thank you, madam. Yeah. Good evening, dear students. So, just a minute. I will be sharing my screen. Fine. So, today's questions for the INICET are. Okay. So, coming to the first question in ENT. This was one of the easiest question. Arrange the auditory pathway sequence. Hope you all know the sequence. E. colima is the code famously known for. This is one of the easiest question, and I hope this was also repeated twice. Right? It's a bonus for you, right? So this is 8th nerve, cochlear nucleus, olivary complex, lateral lemniscus, inferior geniculate body, inferior colliculus, medial geniculate body, and auditory cortex 41 area. Okay, so this is the sequence you need to remember. This is the code word E. colima. Practice it twice or thrice, then it will be easy. So it's a straightforward theory-based question. And coming to the, two questions, no voice. So you're not getting voice. I don't think so. I have unmuted it. Is my voice clear? Audible? Audio visual okay?
Yes, sir.
Yeah, fine. Done. So now going to next question. So this was a little bit of question, definitely. See, try to get the clues the examiner is trying to give you. He's actually guiding you towards the answer. See, a patient is unable to understand the words, but have normal speech and language. So with this line, the examiner wants to tell is that the patient has developed the hearing defect later on, not by birth. So this is not at all a congenital defect. Okay. Because if a person has normal speech and normal language, that means he used to hear earlier, but now he has lost it. Those children with congenital hearing loss, those who cannot hear, cannot develop the speech. If he is unable to hear and he is there is no processing of what is he don't know, the patient himself don't know what he is hearing. So in response, he cannot develop any speech, right? So congenital deafness, both deaf and dumb will be there. But after that, see, post-lingual defect, speech defect, post-lingual hearing defect, in these disorders, the speech will be normal, but the hearing will be lost. So with this line itself, you can exclude two options here. One is Mitchell's aplasia is a congenital disorder where your complete cochlea is absent, right? So this should not be the answer then. Auditory neuropathy spectrum disorders are also congenital auditory disorders. So these two options are removed, right? So next, see, cortical evoked potential is abnormal. PTA and ABR are inconsistent. Okay. So what exactly is this cortical evoked response audiometry, SERA? You have another one called as BERA also, brainstem evoked response audiometry. For this, just listen, I'll be taking 1 to 2 minutes time to explain you it in detail. So this is your pinna, right? So directly from externally, you can see whether this is normal or any appear of any cosmetic defect is there. And this is your external auditory canal. With an otoscope, you can see it whether it is normal or abnormal. And eardrum also, you'll be able to see directly visualize. You can visualize directly the eardrum, right? In middle ear, if there are any issues, impedance will let you know whether there are any impedance audiometry will tell you whether there are any middle ear issues or not. Okay, this was not mentioned in question. We will take all this as normal. Now coming to the this inner cochlea, now coming to the cochlea. See, in this cochlea, if there is any defect, you can identify it by otoacoustic emissions. In case of cochlear otosclerosis, what happens? The entire cochlear bone will get ossified, right? The entire cochlear bone will get ossified, and there is a sensory neural hearing loss to the patient. So due to this, the patient cannot hear normally, okay? There will be disturbed hearing. Definitely, there will be the spatial orientation of the words will be lost. Some words he will be able to hear, some words he won't be able to hear. That makes his listening abnormal. So due to this, he will be developing. Definitely, he won't be able to understand. So definitely, he will be having some hearing abnormality. But his normal speech and language won't be affected unless there is any motor problems in the cerebral cortex, right? So this is about your. So many students were asking whether this could be malingering. So now we will come. Why the malingering is not the answer here? See, in case of malingering, see what is pure tone audiometry. You should know what is pure tone audiometry, what is better, what exactly what we are doing here. In case of pure tone audiometry, what you will do, you will give sounds to the patient, certain frequency of sound. See, for example, 250 hertz frequency sound at a 20 decibels intensity sound, I am giving to the patient. The patient is able to hear this sound. So patient will say that whenever you give that particular tone, pure tone, single frequency sound, pure tone to a patient, and you will ask the patient whether he is able to hear it or not, he will lift his hand that he is able to hear, right? That means the result of this test depends on the responses given by the patient. So it is a subjective test, not objective, subjective. This test depends on the responses given by the patient. So you are understanding the point here. What is the difference between subjective and objective? So if you have a doubt that this patient is not giving proper responses, then you should go for BERA, where you can even sedate the patient and you connect the electrodes and give the sound stimulus. Then definitely the sound wave, once you give the sound stimulus, it will be traveling through the auditory canal, eardrum, all the conductive pathway, and then it will enter the cochlea, and through the auditory nerve, it will go into the brain, right? The auditory cortex, it will be go area number 41, right? So if this auditory nerve is intact, you will put the electrodes to collect the nerve potentials passing through the auditory nerve. Even if the patient is sleeping, to the response to the sound given by you, there should be potentials coming on the BERA graph, definitely, right? You understood my point. So in case of BERA or CERA, cortical evoked response audiometry, definitely there should be, the BERA should be normal. PTA is abnormal, but BERA is normal. That means the patient is malingering, because BERA is an objective test. It does not depend on the responses given by the patient. Okay, so the answer here could not be malingering. This is not the answer here. In case here, if the PTA is, if the question was given like this, PTA is abnormal, but BERA is normal and CERA is also normal, then it could have been malingering. Now the only option left is cochlear otosclerosis, and also this should be the answer, because in cochlear otosclerosis, you have sensory neural hearing loss, right? So when the sound waves are coming and traveling, and there is a problem in the conduction problem with the cochlea, there is the sensory neural hearing loss is there. Definitely the waves of the this auditory nerve, the waves that are concerned with the auditory nerve, that is BERA waves, as well as cortical central waves. These will be definitely, the latency and amplitude will be reduced in these cases, because the sound has to travel through the cochlea. If you have to get the BERA normal, definitely all these things, that is your pinna, auditory canal, eardrum, middle ear, cochlea, all should be normal. Then only your sound wave will travel through entire this pathway into the auditory nerve. Then only the criteria for getting a normal BERA is that first you should check the pinna for any external defects, auditory canal with an otoscope, tympanic membrane with an otoscope. Confirm that all these are normal. Then do impedance audiometry. That means your middle ear is normal. Then do otoacoustic emissions. This should be normal if the cochlea is normal. If the cochlea is abnormal, then otoacoustic emissions are also not emitted. And then next comes your BERA. If the cochlea is normal, you will get a normal BERA. If the BERA is normal and CERA is abnormal, then the defect should be here. So if you take the entire auditory pathway from the pinna to the ESC, external auditory canal, eardrum, middle ear, cochlea, auditory nerve, and central, right? So External visibility will tell you this is normal or abnormal. Impedance will tell you middle ear is normal or abnormal. Otoacoustic emissions will tell you whether cochlea is normal or abnormal. Auditory nerve is normal or abnormal. BERA will tell you. And any problem in the central cortex area, SERA will tell you. So remember this. So the answer here will be cochlear otosclerosis. Hope you have understood the point here. Next, coming to the rhinosporidiosis. Yes, it is mostly seen in the coastal areas. You can see a strawberry-like tumor arising from the nasal vestibule. And you can see that typical on histopathology, you can see the sporangium with its endospores all coming outside. The endospores are the infective stage in this case. And this is classified under protozoa now, earlier called classified under fungus, right? So 3 stages of life cycle, you know, it's a leafy polypoidal mass, and diagnosis will be by biopsy. And during treatment, you should cauterize it. You should remove the tumor excise with cauterization of the base. So this is a straightforward question, right? Rhinosporidiosis, very easy to answer. The only difficult question is this one. Okay. So here, difficult question, sir, I didn't understand. So just let me know. Let me tell you. See, this is your ear pinna. How do you know whether ear pinna is normal or abnormal? So just by inspection. External auditory canal, just by inspection, you can know whether it is normal or abnormal. Eardrum, you can directly see with the otoscope whether it is normal or abnormal, right? Now, as you go inside, you will be having middle ear. If middle ear is normal or abnormal, you cannot see this directly. So you have to do an impedance audiometry, right? So if impedance audiometry is normal, then this entire middle ear is also normal. Now inside comes your cochlea. How can you know whether cochlea is normal or abnormal? Otoacoustic emissions will tell you, because these are emitted from outer hair cells. And now from the cochlea arises your auditory nerve. So how will you come to know whether this is auditory nerve is normal or abnormal? BERA will tell you. And where this auditory nerve is ending? In the central cortex, ultimately in the area number 41, auditory cortex, it is ending. How will you know whether the auditory cortex is functioning or normal? SERA will tell you, right? So what the examiner is saying, whether the patient is unable to understand the words because his hearing is abnormal, but he has got normal speech and language. Congenital hearing loss conditions, the patient cannot understand. The patient won't have normal speech, deaf and dumb, because once there is no input, there won't be any output from birth itself, right? If the patient has developed hearing loss later on, then his speech and language will be normal, but only hearing will. That is post-lingual speech defect, okay? So these are the two, prelingual and postlingual. Before developing the speech, that is prelingual. After developing the speech, hearing loss has come, that is postlingual. So remember the difference. The examiner with this line is trying to say you that it is a postlingual kind of defect. So definitely auditory neuropathy, Mitchell's aplasia are congenital conditions. So these two are not the answers definitely. And malingering, BERA will be abnormal, PTA will be abnormal, BERA will be normal, SERA will be normal, because BERA and SERA are objective tests, okay? And your pure tone audiometry is subjective test. Pure tone audiometry depends on the responses given by the patient. He may tell anything, even after he hears, he can say he is not hearing. That is malingering. So that cannot be found with PTA, but that can be found with BERA, where even if the patient is giving wrong answer, in BERA, which is objective test, which is not concerned with the patient, BERA will be normal. Even though the patient is saying not hearing, is not hearing anything, his BERA will show that he is hearing. So that's the way how to, but in question you can see ABR is inconsistent. Your BERA is inconsistent, the examiner is saying. So malingering could not be the answer. Cochlear otosclerosis is the answer here. Hope you understood now, right? I'll be passing on this to the next, sir, Gaurav sir. Hello?
Yes.
Yes, sir. Please take over.
Now,
Hi, Praneeth, sir.
I'll request Dr. Gaurav Nagpal sir to please take up the questions of OFTHA. Thank you, Dr. Praneeth sir. You can stop sharing the screen so Dr. Gaurav Nagpal can come in action now.
Yes, sir. So nice of you, sir. And thank you, Praneeth sir, for a wonderful explanation for this question. Even though it...
that is the only tough question given, sir.
It was a very tough question. But you tried to explain it very nicely, sir.
Thank you, sir. With all your blessings.
I'm trying to share my screen and let's see. Just give me a minute. Is my screen visible?
Yes, sir. Fantastic it is.
And am I audible? I hope I'm audible because you are replying.
You are audible and visible. You are rock solid.
Oh, thank you, sir. Thank you very much. And Aftal questions were difficult, students. Yes, they were difficult. And let's see. One was a sitter, but other was a little difficult. So there was a picture given like this where they had shown two images. And one image had congestion, which was being shown there. The other had blanching after phenylephrine use. Was that the question? Was that the question? Yes, yes, yes. Somebody is answering scleritis, episcleritis, and the choices that are given to me were episcleritis, scleritis, plectin. Yes. So here I would like to go with the choice of episcleritis. Nodular episcleritis is the answer. See, this is the nodule with congested vessels. And phenylephrine is a decongestant. It is a vasoconstrictor, so it causes decongestion. So yes, I would like to go with the answer episcleritis. This was correct answer. Okay, so this was everybody's agreed. Yes, Rohit. Yes, Aishwarya. Yes, Foxtrot. Okay. So this was anybody having the fourth option there? Anybody able to give me fourth option? No. So we'll go with the correct answer, episcleritis. Moving on to the next question. Which of the following is a direct gonioscope? Gonioscopes are of two types, indirect and direct types. Indirect is one which is used commonly in the OPD, where you can do it on slit lamp. Direct is the one where you see the angle directly. Okay, so the choices that I have got till now were Goldman's and Cope's. So Goldman is the one which we use routinely, daily, day in and day out we use. That is indirect. It is easy to do, being in a sitting position. And yes, Cope's is the right answer. Cool terrapin, yes. So, okay, Simu is saying it was except Cope's. Except Cope's? No, Cope's is the choice of direct. So there are two types of lenses, indirect gonioscopes and direct gonioscopes. Goldman, Zeiss and Posner's are direct one. And Cope's is the one which is used for surgeries, because in this you are able to see the angle directly. See, this is how the angle is. And because of the total internal reflection, you cannot see the angle directly. So you need a lens over this to overcome the Richardson and Rutherfords. No, they were not there. So the Cope's is the correct answer. So which of the following is a direct gonioscope? Cope's is the one. Okay. So moving on to the next question, identify the marked structure. So the choices that have gone till now are Petit and Hanover's. Petit space and Hanover space. Canal of Hanover and Petit Hanover. I really don't know what the examiner was trying to find out here. It is a very difficult question. I'm pretty sure even Dr. Srikanth or anybody cannot answer this, because what is the clinical significance of asking this question is very, very difficult. So there are two types of canals which are there. See, if this is the lens, the space here is called as the canal of Hanover. It is between the anterior suspensory ligaments and the posterior suspensory ligaments. The space between them is called as the canal of Hanover. And the space between the posterior suspensory ligaments and the anterior hyaloid. Hyaloid is the vitreous. Between the vitreous and this posterior suspensory ligaments is the canal of Petit. So there are these two canals which are there. These are anatomical space. So the answer would be identify the structure. So it was the Petit's canal. If it was, yes, I've got this. Some students have told me it was already marked in the paper. So that is a bonus question for you. That means it was already marked. So good. So this is same image. Okay, good that I've found the same image. Thank you, students. Thank you for identifying this. Moving on to the next question. Sequence of staining in dry eye. So they had given fluorescein stain, lissamine green stain, rose bengal stain. Fourth choice, I don't know what was there. So first is always the fluorescein stain. Fluorescein stain is the stain which will pick up any dry spots. So any dry spots can be marked with this. It is fluorescein stain. And then is the lissamine stain. Lissamine stain which stain the dead cells. So it is stain which will pick up the more dry areas on the conjunctiva. This is for conjunctiva. Whereas the fluorescein is for the cornea, more for the cornea. Lissamine green stain is more for the conjunctiva. Rose bengal stain causes lot of stinging. So it is not very preferred. So you would not prefer using rose Bengal stain. So the sequence of staining I would keep as fluorescein stain followed by lissamine green stain, and rose Bengal last. Yes, I would say yes last. So this was the fluorescein stain. This is how fluorescein stain will look like, where the cornea is getting stained by ... This is what is punctate keratitis. Okay, these are SPK, superficial punctate keratitis, will look like this. And this is how the lissamine green stain will look like. For a colorblind person like me, they appear to be so green, but actually this is dark green and this is bluish kind of thing. Okay, so this is how lissamine green stain looks like, which is used to stain conjunctiva. So first fluorescein, second lissamine green, and third would be the rose Bengal. Fourth stain, I have not been able to find what was the choice given. So there were 3 different sequences. So sequence kya tha, I don't know, but I would keep it as 1, 2, 3. I don't know if the other choices were 3, 2, 1 or what. Okay, so this is how it is. And earliest change in glaucoma in perimetry, we are all aware, glaucoma field defects we have done. So this is how the isopter contraction is there, then with the bearing of the blind spot, then scotoma in the Jerem's area, sedal scotoma, arcuate scotoma. Okay, then there was double arcuate and tunnel vision. So first is isopter contraction with bearing of blind spot. That is the first change which is there. So this is the first. This was the most direct question amongst all opthal questions. So this was the sitter spotter which was there. So these were the 5 questions that I've been able to find. Okay, any answer, any question that you have apart from these? So, okay, they are specific to glaucoma. So specific to glaucoma would be this one. Specific glaucoma will be scotoma in the Jerem's area. I don't know whether that was in the choice or not. I don't know whether that was in the choice or not. If that was in the choice, then specific to glaucoma would be scotoma in the Jerem's area. True about perimetry. See, isopter contraction and bearing of blind spot is not specific to glaucoma. But it is the first change. So it would depend upon the question which was there. So the language of the question, the exact language of question, as we come to know in next 2-3 days, we'll come to know the exact language of question. That would depend, that would determine the choice. Okay. So changes in optic nerve head is must for diagnosis of glaucoma. Yes, changes in optic nerve head are there in glaucoma. Yes, they are there. Kinetic perimetry better. So we do a static perimetry which is there. So nowadays computerized perimetry is being done. Dynamic and static perimetry, visual field effect plus ONH. So see, I am not able to find the correct options. One was kinetic perimetry. The other is fixed perimetry, static perimetry. So the Humphreys visual field analyzer is a type of a static perimetry. See, kinetic is when the stimulus is being moved from periphery to center, when the same stimulus is being moved. Whereas static is where you are giving the signal is static, but you are varying the intensity and the spot size. So nowadays we use a Humphreys visual perimeter, which is a kind of a static perimeter. So if the choice was static perimetry, then static perimetry would be the correct answer. Static perimetry would be the correct answer. Yes, the intensity. No, static perimetry is not where you bring, no, Aishwarya, in static perimetry, you are not bringing, in kinetic, the term itself is telling, kinetic, the signal is moving from periphery. Static is the signal is remaining there and you are increasing the spot size or the illumination. The size or the illumination of the spot is increasing and decreasing, that is static. In kinetic, the same stimulus is being moved. So here the answer would be static perimetry. Okay. So these were the questions which are there. So who wants to become an ophthalmologist? I believe all of you are good people. So all the best. These were the questions were there.
You can also call them an orthopedic surgeon.
Yes. If they want to become an orthopedician, yes.
Sometimes they can have a strong hammer.
Sir, my first choice was orthopedics, but I think I became a good ophthalmologist.
You wanted to make a bigger setup, earn more name and fame and money.
I wanted to replace bigger joints rather than the lens. I wanted to replace joints.
Fantastic. So now we have Dr. Atul with forensic, and let's listen to him. Gaurav sir will stop sharing the screen, and then this is Dr. Atul.
Over to you, Dr. Atul.
Everyone, this is for the forensic medicine questions. Forensic medicine questions. I have got the questions in bits and pieces. I think one of the questions, a lot of questions have been asked in forensic medicine. I think one of the question was on the bitter taste. A bitter taste occurs due to which one of the chemical? And this is a very classical thing. The bitter taste, the answer here is alkaloid. Alkaloid is the answer. Alkaloid is the cause of the bitter taste for many, many poisons, including plant-based poisons. Okay. Second thing was, I think that the question was on the distance of the gunshot wound was shown, and the distance was asked. There is no blackening, no burning, no tattooing, nothing is present, neither on the margins nor around the wound. So the answer here is distant range. Okay. Then another question was on a 16-year-old rape victim, which has come with mother. And so what is the first step to be taken? Whether we should take the history first, or the consent should be taken for genital examination, or the reservation of clothes should be done. See, I do not have all the choices, but please remember, the first step for anything will always be consent. Okay, nothing can be done before consent. Either the history can be taken, nothing can be taken. The first step is always consent. And for a sexual assault victim examination, the consent of victim is sufficient in case her age is more than 12 years. The consent of victim is sufficient in case her age is more than 12 years. So here the age is 16 years. So the consent of the victim will be sufficient. Now, another question was Blackfoot disease. This is a very straightforward question. Blackfoot disease is a characteristic feature of arsenic poisoning. It's a classical feature of arsenic poisoning. It occurs due to constriction of the peripheral blood vessels, and very characteristic feature of chronic arsenic poisoning. Then I think this is a very age-old question. All of you must have got it correct. A feature of chronic abuse of cocaine. Here the answer is formication. Here the answer is formication. That is cocaine bug. The person feels as if insects are crawling under the skin. It is a kind of tactile hallucinations. It is a kind of tactile hallucinations. Then I don't have the complete question, but some image of burns were seen. In case blisters were present, then it will be, answer will be chemical antemortem burn. Because in a chemical burn, the blisters are not present. In a chemical burn, blisters are not present. Okay. And in a post-mortem burns, blister can be present, but post-mortem burns, the blisters are very rare. And it is only, as I know, the blisters in the antemortem burns in this image were having serous fluid. In post-mortem burns, it will not be serous fluid. It will simply be thin tear fluid. Which of the following is not a feature of antemortem drowning? Now, here, students might have got confused. Please remember, water in stomach, it is a feature of antemortem drowning. Diatom test is definitely a feature of antemortem drowning. Froth in mouth and nose is very good and very specific feature of drowning. The main answer here is washerwoman hand, because washerwoman hand is can be found in both antemortem and postmortem drowning. It simply implies that body was immersed. Whether it was immersed before drowning or after drowning, that is not a part of it. It simply says that the body was immersed. Now, another question was on the post-mortem staining and drowning. I think I don't have the exact answer, but post-mortem staining and drowning occurs in case of a drowning. The body floats in the head down position, in the face down position the body, face down position the body, the float. So the postmortem changing the dependent. What will be the dependent part? Dependent part will be face, then the limbs, and also the lower part of the next. There was some question on lead poisoning. I do not have the details of that, but I still do not have the complete question. But I hope with this maximum questions you should be able to get the answers. Thank you.
Thank you very much, Dr. Atul sir. And now we will request Dr. Shrikant sir. This is the second last subject. And then we will have the medicine questions. So we have anatomy, right? So Dr. Shrikant will be talking to you. And this video will continue as live, and you can keep writing your suggestions to the question that we have discussed or whatever you feel, right? We will be more than happy to assist you in further completing the questions or any help required. And as discussed earlier, we will be trying to, in future, create the videos of each subject specifically so that the question and the options are available for you. So over to you, Dr. Shrikant sir.
Thank you very much, team. Hello, dear students. Hope you all did very nice. I'm just sharing the screen, and I will not take too much time for you. What I had known questions were a little bit difficult.
Shrikant sir, you can decrease the volume of the YouTube that you're playing.
Okay, sir. Okay, yes, sir.
But that's coming in the videos.
Yes, sir. I think screen is visible.
Fantastic it is.
Yeah. Thank you so much, sir. Thank you. So what I got information from the student sides that a question had been asked regarding the humerus fracture. So we all know exactly. If you all know the option, you can tell me. There was the osteology image, and they had asked regarding our medial epicondyle fracture. So we all know behind the medial epicondyle, ulnar nerve is located. Okay, so this was the one question. And here was the another question. Always in INICET, you will see the gluteal region. It is very favorite question in INICET especially. Okay, dear students. So there was the question, superior gluteal nerve supply all except. So we all know that superior gluteal nerve, it supplies the gluteus medius, minimus, and our tensor fascia lata. While the inferior gluteal nerve, it supplies the gluteus maximus. So here the piriform was kept in option. Please inform me, dear students, if any changes in question pattern or option we have to do. Okay. Yes. And there was the one question. This is our question. It had been asked in All India NEET PG 2019. There was the question that pancreas, in front of the pancreas, there is a superior mesenteric vein and the artery. Related to that part, a little depth question. Okay, not accept. So Ashwarya is saying not accept. Okay, fine. But there was the question related. Yes, so Muhammad Samdani is saying same question. Okay, fine. So there was the question related to this 2019 pattern, little more detail. Anterior relation of the third part of the duodenum, all except. So here is the one image from our standard textbook. You can see that our duodenum, sir, there is our first part of the duodenum continuing as the second part, and then it is coming as the third part, and then continuing as the fourth part of the duodenum. Okay, we all know, earlier I told you, S for splenic vein, S for superior mesenteric vein is equal to portal vein. Okay, yes, Prabhat Pandey, you are right, beta. Okay, fine. Yes, correct, Vishwanath, you are right. So the superior mesenteric vein, it is passing in front, okay, sir, along with the superior mesenteric artery. So this was the question in your NEET PG 2019 uncinate process cancer. The same topic had been asked, and you can see it is bounded by the our root of the mesentery also. Yes sir, there is the our root of the mesentery. Mesentery is covering this all the structure. हमने देखा था बेटा कि पेरिटोनियम की covering होती है. So superior mesenteric vessels as well as root of the mesentery. Also there is the location of the our intestinal loop. So third is the intestinal loop. But remember the gallbladder, sir, the gallbladder is in front of our second part of the duodenum. So exactly this pattern had been asked. Actually, this is the question from our first MBBS relation of the duodenum, which had been asked in this INICET exam. Entry relation of the third part of the duodenum, all except. So answer, remember here the gallbladder fundus. Okay. So yes, Purushottam, superior mesenteric vessels is right. Jejunal coils are also, root of mesentery also, but gallbladder fundus is related to the second part of duodenum. D2 you can say. Yes, answer gallbladder. If any correction, please inform me better. Now come to our next question. There was such kind of the question pattern, image-based question. Which of the following statement is correct regarding following muscle shown in the image? Okay, so this image had been given. I taught you earlier with the three-dimensional orientation. Students, we are saying that, sir, there was our rhomboid muscle. So just to see rhomboid major and minor. This is our trapezius muscle. Okay, sir. This is our rhomboid muscle. Getting the point? Fine. Yes. So over this, there was the arrow, and you all know, sir, this our rhomboid muscle, it is retractor. Okay, so I'm just telling you the answer only. I'm not taking your time. There was the arrow over this rhomboid major or minor rhomboid muscle. So rhomboid muscle, they are responsible for the retraction of the scapula along with the middle fiber of the trapezius. This is the correct answer. Remaining all elevates the scapula. Yes, along with the fiber of the trapezius. It is wrong. Rotate the scapula. This is wrong. Rotate the scapula, tilting the glenoid. This is wrong. So answer was the first. Okay, fine. Okay, trapezius was not given. Okay, any more thing? Yes, correct Anupam. Rhomboid muscles, they are shown, and I got the information. There was the position of the appendix, but exact options I am not getting. We all know the position of the appendix. This is our location in the cecum. So you will see the most common position, retrocolic, 65%, and in front of the ileum, pre-ileal, behind the ileum, sir, there is the post-ileal. You can see the promontory position, pelvic position, mid-inguinal, and another is a paracolic. Please inform me if this was there. Okay, it was multiple choice. Okay, multiple correct. Okay, so if anyone can inform me, please tell me what kind of the options were there. So these are the different position: retrocecal, 2 o'clock, 3 o'clock. 2 o'clock is the splenic, 3 o'clock is the promontory, and our pelvic position. Purushottam is saying subcolic, subcecal. You can say also that subcecal is mid-inguinal. So that is a 6 o'clock position according to the Purushottam. Okay. Okay, dear. Okay, Anupam, retract and depresses glenoid cavity. Remember, it will retract, but it will not depress the glenoid cavity. Okay, fine. And this is the paracolic, which is 11 o'clock. Okay, fine. Now, look here. There was the question, sequence in the floor of the fourth ventricle. So this was the question pattern asked 5 years before. But again, this pattern had been repeated in your topics. तो बेटा ये एक अपने आप में difficult topic है. इसको हमको समझने के लिए एक बड़ी ऐसा concept चाहिए. Yes, I will make separate video for you. लेकिन इसको याद करने एक बड़ी ऐसा तरीका है. What are the different structures at the floor of the fourth formula? You can remember गुस्से, गुस्से, बे, gue, gua. There is one funny mnemonic, gua, ba, gussa. Okay, and at the last there is a special somatic efferent. So this is the one funny way. What is the concept behind this funny way? I'm not saying in this our short duration, but later we will do, and you will never forget this concept. This is a very interesting and very conceptual topic. Fine. So this is the sequence. So in the any kind of the question, you can remember this sequence: general somatic efferent, then branchial apparatus efferent, that is our special visceral efferent, then general visceral efferent, then there is the two column, they are getting fused, our general visceral efferent and branchial efferent, also you can see special visceral efferent, and then general somatic efferent. Okay, so this is the sequence. So whatever the option was given, you can opt according to it. I told you the sequence: general, gusse, then Be, and then Gue. Then remember the Gua, and then there is the our Ba, and then Gussa. And last one is the special somatic efferent. So whatever you will see, according to these options, what are given here, you can see the general somatic, special visceral is given, special somatic is given, special somatic will be last, general somatic is given, okay, and general visceral. So whatever the option, different students, they are asking the medial to lateral. Yes, medial to lateral, and options are different, okay, but I told you the basic thing. According to it, you have to opt the answer. Yes, so these are the questions which I got. Any more thing, please inform me. Okay, so this is from my side, sir.
God bless you, Dr. Shrikant. We are done with 18
Thank you
subjects.
so much, sir.
And now we are left with the last subject. All right. Before we go on to the last subject, I would like to share something with all of you. So I got this from the net. This is called as a fear, right? Am I visible and audible? Is this okay?
Yes, sir.
Fantastic. So it is said that before entering the sea, a river trembles with fear. Right? She looks back at the path she has traveled. From the peaks of the mountains, the long winding road crossing forests and villages. And in front of her, she sees an ocean so vast that to enter there seems nothing more than to disappear forever. But as there is no other way, the river can go back. Nobody can go back. To go back is impossible in existence. The river needs to take the risk of entering the ocean, because only then will fear disappear. Because that's where the river will know it's not about disappearing into the ocean, but of becoming the ocean itself. All right. So this is what I had to speak in this wonderful session of INICET May 2023. We had 18 subject specialists taking 18 subjects, and medicine, one of the most important subject, right, could not be taken because Dr. Dilip sir could not be here. But then, we have our rock star who's always there to show up when we are in need. And so she's understood the message that she can't wear black. Black is copyrighted. So she has changed her clothes and she's here with, she's going to tell you the points. We'll come out with a medicine video in the app. And as an honest gesture, that video will be released on YouTube as well. All right, Zainab, make it a point that when sir gives us the video, that video comes as the medicine video on YouTube as a complete session of INICET May 2023. And over to you, Zainab, and you can wrap up the session. Thank you very much. God bless you.
Thank you, sir, for being there throughout and conducting this. I think this was much, if you remember in NEET, we had come up with an impromptu recall session, and now today we were better planned, but I think we were the earliest to start and earliest to wrap up all 200 questions. And I think it is historical, and all credit to sir for making this so smooth. Definitely Dilip sir is gonna come up with medicine questions. Now I was trying to recall medicine and I realized that everything is medicine actually. Path is medicine, pharma is medicine, medicine is medicine. So there are so many questions, but because I was there since the afternoon, a lot of it has been covered by Sparsh sir and GRG sir already. So very few questions, were remaining, one of which was an iron gap. So they'd asked you to calculate. I was talking to the students and a few of them did not include potassium even though it was given. Okay, so this is a very common thing which I have particularly mentioned in my class also, you know, ki potassium diya hai, then you have to include it. If it's not given, don't assume that potassium would be 3 or 4. Then you ignore it. But when it's given, you have to take it. And in fact, the options were like that. Hai na? They were 39 and then I think 35 was also one option. So they actually knew that there are certain students who are going to exclude potassium. Hai na? Just tell me if this question was there. So potassium is included. When it's given, why would it not be included? All right. So the definition of anion gap is sodium plus potassium minus bicarb plus chloride. All right. So you have to include it when it's given. A lot of times it's not given because it's an intracellular thing. So it's not given a lot of times. Okay. So ye question galat nahi karna. I hope you got that. What is VOR? And lung volume question? What was lung volume question? I think was when intra airway pressure is 0. That should be FRC, I think, from, if I'm not wrong. That was FRC where intra airway pressure should be 0. Hai na? So that is the functional residual capacity. 35 option was there. Hai na? Yeah, it was there. 39 option was not given. If 39 was not given, then you mark 35. But I think 39 was there from what I have asked students, you know. So, ठीक है, अगर 39 नहीं था, then 35. But if 39 was there, then that's the better answer. If potassium is given, I don't know why they would have not given 39. Okay, if 39 was not there, then it's 35. Okay. All right. So Simu has gone into a lot of phases. First, he was very happy that potassium nahi include kiya. Then he said potassium include. Then he went sad, and then he realized, "Arey, option hi nahi tha." So it was not to be included. All right. So probably that 43 agar tha, 43 is not the answer. So then if only 35 to 35 hai. ठीक है. Moving on to the next one. Torsades के pointers के ECG पे question था. So there was a question on there was a polymorphic axis of the ECG. So I think that was straightforward. I don't know if they asked magnesium sulfate or they just asked diagnosis. तो फिर answer इसमें तो कोई doubt नहीं है. Any doubts here? Your comments are lagging a bit, so I'll just wait. हाँ ठीक है, all 4 numbers you don't have to remember. अगर आंसर बन रहा था तो वही है. Okay, ठीक है. All right. I hope this was there. No controversy here in Torsades de pointers. Right. Next question was on a mixed connective tissue disorder kind of a picture. They'd given you Raynaud's and they'd described polymyositis probably with perifascicular atrophy, and they said about myopathy CK being raised and iska antibody pucha tha. Is this correct? So there was a question on mixed connective tissue disorder as well. So this was, I think, a diagnostic question probably, ya fir antibody pucha tha, then it will be U1 ribonucleoprotein. All right. So jo bhi pucha tha. Okay. The alcohol influence or not influence question, I don't know what was the question. Psyche mein discuss hua shayad. I think sir was looking for that question, so probably he'll include it in his recall. I'm not sure what the exact question was. I hope this is fine. Yeah, ye theek hai. So Raynaud's is done and Torsades is done. Smudge cells ka image tha and did ask diagnosis. Hemat ka straightforward hai. This is CLL. Then Barth syndrome, you guys were saying. So Barth syndrome has cardiomyopathy, all right? So this, if you knew itna cardiomyopathy, so the answer could have been clearer. It was cardiolipin biochemistry question. Barth syndrome has cardiolipin, which was accumulated, okay? Child came with altered mental status and vomiting. What could be the diagnosis? Huh? What is or matlab or kuch batao, history and other options? Just altered mental status and vomiting? Could be dyselectrolytemia. Or just give me something about that. पहले इतने कर लो जो मेरे पास है, and then you tell me more. That is in its own parallel world only. You are not listening to what I am saying, and you are giving all new questions. Then there was one question which was hyper IgM CD40 में defect था. So what happens? CD40 ligand का interaction doesn't happen. So isotype switching doesn't happen. So this is hyper IgM syndrome. Then Kawasaki to answer was given only. So ye to, I hope nobody got this wrong at least. You are getting a score of 1 out of 200 because this was given. Flow cytometry, yes, for CD5 and CD23 status in CLL. Yes. सेंट्रोमियर नहीं होगा, U1 RNP होगा बिकॉज सेंट्रोमियर तो क्रेस्ट को पहचानेगा ना. सो crest में myopathy will not be explained, so it won't be crest. If it was something else with Raynaud's, then crest, but with myopathy, then mixed connective tissue disorder becomes more likely. Okay. After that, blood products की half life पूछी गई थी. So this we have included in our hemat only. We've done all of the blood products. So RBC, it will depend. Usually it is 6 weeks if SAGM is what is used here, right? So ये RBC का 6 weeks होता है, which is 42 days. फिर platelet का is around 5 days. If they are agitated, it's stored at room temperature. That is why it has highest risk of bacterial contamination. And then we have cryoprecipitated FFP, which are -30°C, so they can be stored around a year, right? I hope this is all correct. Okay. तो ये blood products के storage पे question था. U3 RNP, if that was there, it will be correct. Okay. Person is alcoholic wala question. I think Psyche, Praveen sir will take it up. Okay. I think he will be the best person to answer this. Child with vomiting, electrolyte imbalance. So I think you can just apply hamara. I will tell you how, I would solve it. You guys are just throwing all subject questions at me. So in vomiting, you would have everything going down. So hypokalemia, hypochloremia, and you will have metabolic alkalosis because of vomiting. हाँ, तो ये आप use कर सकते हो. Hyponatremia as well. So if there is altered mental status, hyponatremia would be your best bet. Am I on the right track with the question? Was it how the question was framed? Because I just got vomiting and altered mental status and electrolyte abnormality. So from that, I am just extrapolating that this could be what is asked. Half-life में correct option पूछा था, temperature wrong था कोई option में. Okay, but like I have told you what is there, तो इसमें से जो भी गलत था, so this is what we got a no. Okay. ठीक है. All right. After that, one question on thymoma. They love asking thymoma. Last time they asked pure red cell aplasia. This time they asked pretty simple that it's in the posterior mediastinum or anterior mediastinum. So I'm sure you cracked this. It's in the anterior mediastinum. Okay. Right. What else? In massive blood transfusion, you'll have hypokalemia and hyperkalemia is possible. Hypocalcemia will be seen. Magnesium, I don't think is a problem. All right. So hypo and hyperkalemia is possible. Hypocalcemia is possible. And you can have metabolic alkalosis also and acidosis also. Thymoma is the most common anterior mediastinal mass. That is correct. We are just switching from one question to the other, but I think, yeah. So anterior, most common anterior mediastinum. So I think no controversy there. Then coming to iron deficiency anemia, again, pretty simple. They'd given you iron value. So iron is low, TIBC is going to be high, ferritin is going to be low, and transferrin saturation, I think, was wrongly marked. It was given as high, so this is wrong. Transferrin saturation will also be low. ठीक है, तो ये easy है. Okay. Then non-immune hydrops, I think, has been discussed already. So ABO incompatibility would not be non-immune. It would be immune, right? Immune mediated isoimmunization. Tube order to discuss ho gaya, right? We have already seen this. First would be culture. Uske baad jis order mein main padhati hu, that is the order in which it comes. Hai na? So the first one is going to be blue, then black. Then you will have the purple vial, and last would be gray. So in this order, you remember our table, I tell you to have visual memory. So in that only we will have. Hemi-neglect was asked. Again, this image is a favorite of INICET. They give you this half-shaved face on the left side, or they give you a half-drawn clock face. So that is by the non-dominant parietal lobe, which regulates hemi-neglect. So it's a non-dominant MCA territory stroke ka sign, basically. So that's the right parietal lobe. One easy question was cystic fibrosis, which channel is gone with chloride. Again, similar topic. Last time they'd asked delta F508 का mutation होता है phenylalanine का. So this time they'd asked a simple question कि chloride channel जाता है. ठीक है? Okay. Dialysis पे भी था beta 2 microglobulin. That's good. We did discuss that, right? A lot of questions now, are coming which I did not read earlier when the students were giving recall. But yeah. So So this is what I had. I hope I did justice. I'm sure Dilip sir will do a much better job at discussing medicine questions, but I am just a substitute player as of now because we are in a team. So I am just playing as a sub right now. So I hope I did enough justice. And thank you guys for sticking around for so long. You've come back from a very hectic, a very difficult exam, and you still managed to sit and recalled the questions, along with us. That just goes on to show that you're not done yet, and you want to do very, very well. So I hope that is the case, and you get the best rank in the exam, and you do very well. And now just take a chill pill, just relax. अब और recall मत देखना and stop with the game कि इन्होंने तो ये बोला था, इन्होंने तो ये बोला. आज का दिन rest ले लो, break ले लो. I think you've done enough recall and you deserve a good break now. So just stop with the recall comparisons now. I don't want you guys to get trapped in that.
जैनब, तुम्हें कोई जोक आता है?
नहीं सर.
तो आ गया बंदा जोक सुनाने. सर वो बच्चे बोल रहे हैं वो तन्मय भट्ट वाला क्या पंगा हुआ है?
के जोक तो वायरल हो चुके हैं.
नहीं कोई
सर
नहीं,
क्या है वायरल क्या हुआ है सर? वो वायरल क्या हो गया जोक?
वायरल तो यार आजकल चल रहा है COVID-19.
अच्छा कुछ और सुना दो सर. कुछ तो सुना दो सर, बच्चों को खुश कर दो. बिकॉज आई ऑलवेज यूज्ड टू से कि एग्जाम देने के बाद तुरंत बैठ के सारे क्वेश्चन लिख लो और उसके बाद अच्छा सा ब्रेक ले लो.
हाय गौरव सर.
तो अब आप कुछ जोक वोक सुना दो ताकि हम लोग
बस मैं सबको कहना चाह रहा हूँ कि एग्जाम थोड़ा डिफिकल्ट आया था, तो टेंशन मत लो, सबके लिए डिफिकल्ट था. सिर्फ आपके लिए नहीं था. तो इसमें कोई टेंशन लेने की बात नहीं है. अगर आसान आता है तो भी खुश होने की बात नहीं है, सबके लिए आसान है. और डिफिकल्ट आता है तो सबके लिए डिफिकल्ट है. देयर इज नो पॉइंट के टेंशन लो के इतना मुश्किल आ गया. तो वो सबके लिए सेम है. अगर आपने थोड़ा बहुत पढ़ा है, जैसा पढ़ा है सब सेम आ जाएगा. तो अभी तो जोक सुनाने का तो मेरे का वो भी नहीं है, काम में बहुत बिजी चल रहा हूँ मैं. तो मैं सबको कहना चाह रहा हूँ ऑल दी बेस्ट. टेंशन मत लो, अगर नंबर कमाएंगे तो सबकी कमाएंगे.
टेंशन आगे बहुत है.
हाँ
ये तो इसकी जरूरत नहीं है.
Yes, this is just one exam. अगर आपको लग रहा है ये आपकी जिंदगी का आखिरी एग्जाम है, you are very wrong. लाइफ में और बहुत एग्जाम्स आएंगे, बहुत रिकॉल्स आएंगे. So don't worry at all. आज ब्रेक लो, अच्छा खाना खाओ and just relax.
हमें देखो, हम भी बैठे हुए एग्जाम भी दे रहे हैं आप लोगों के साथ.
चलो ओके सर, बाय 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 गोविंद सर, बाय गौरव सर,
बाय एवरीवन, ऑल द बेस्ट. टेंशन मत लेना बस बिल्कुल भी.
बेस्ट ऑफ लक टू ऑल ऑफ यू. बाय, थैंक यू, बाय.